Hey, do we have Candace or Carrie today?
Hey Shane, it's Candace.
Candace.
How are you?
Hi, Madam Chair.
Hey, Shane.
Madam Chair and Shane, we are live, just so you know and are aware of your conversation.
Thank you.
You're welcome.
Hey, everyone. I think we'll get started in the next few minutes. Shane, if we're ready to go. Or Candace, I'm not sure who's. I see.
Candace, we're good to go. Next.
All right, thanks. All right, Ethan, thank you for being here, and Suzanne and Saren and Tammy. Who else is in there? Hey, Al, how are you? Laura. Oh, wow, we've got a big crew here today. I love it.
How are you?
Excellent. How are you? How's everybody?
Good.
We haven't officially started, but we are live and recording on camera. I'm sorry, Shane, did you tell me I was good to go?
I know that we're live streaming, but I think we're still waiting for a couple more people for the first panel, the superintendent.
Okay.
Madam Chair, as far as the video is concerned, we're all set to go on that side.
Okay, so we'll just wait for the superintendent, and I see her coming. So I'm gonna get started with my script, if that's okay. So just to.
Hey, Anissa, give me just 1 minute.
Oh, sure, take your time.
Finishing up something, give me just 1 minute.
Oh, let me know. Is everyone else good? Just everyone else doing okay? Surviving? It's been a long week. I know for a lot of
Yes,
you.
how you doing?
Fine. Fine. I'd rather, I guess, yeah, I don't, I don't have much to say. I don't have much to say. Oh, I know that also Jessica's going to join us too. Thanks, Ed, for being here. I'm not sure where our colleagues are.
Do you, Counselor Bobby George, do you want us to be on video or show our, because in school committee, they have, rules that they just want the committee.
No, I would, no, it's whichever you prefer,
Okay,
whatever you are comfortable with.
that's great. Okay, thank you.
You're welcome.
Okay. Sorry about that, Anissa.
That's okay. You're fine. You ready to go?
Yep.
I'm actually waiting for Jessica Tang. I know she's coming, so might as well. I am gonna get started though. There she is, perfect timing. I'm gonna get started because I do have a little bit of a script that I need to read anyway to get us to where we need to go. So calling this meeting to order. Good afternoon, everyone. My name is Anissa George. I am chair of the Boston City Council's Committee on Education. In accordance with Governor Baker's March 12, 2020 executive order, modifying certain requirements of the open meeting law and relieving public bodies of certain requirements, the City Council will be conducting this hearing virtually. This enables the City Council to carry out its responsibilities while adhering to public health recommendations and ensuring public access to its deliberations through adequate alternative means. Today's hearing is on docket 0979, order for a hearing regarding the implementation of the BPS Ready plan. This public hearing is being recorded and live streamed on boston.gov/city-council-TV. It will also be rebroadcast at a later date on Comcast 8, RCN 82, Verizon 1964. We will take public testimony at the end of this hearing. If you wish to testify via video conference, please email Shane, SHANE, .pac@boston.gov to sign up. When you are called, please state your name and affiliation or residence and limit your comments to no more than 2 minutes to ensure that all commenters can be heard. You may also submit written testimony by emailing ccc.education@boston.gov. This afternoon, I'd like to note that we are joined by one colleague for now. I expect a few others will join us as the hearing goes underway. So I'd like to welcome Counselor Ed Flynn to be with us. I would also like to, we've also been joined by Counselor Andrea Campbell. I want to briefly introduce the panelists before giving colleagues an opportunity to give opening remarks. This afternoon, we'll be joined by Superintendent Brenda Cassellius, Senior Advisor Tammy Poost, and Suzanne Salter Bennett, Director of the Boston Public Schools Nursing Program. We also have a number of others available to answer questions or support today's conversation. We also have a panel including Jessica Tang, the President of the Boston Teachers Union, Lauren O'Malley Singh, school nurse at ACC, another Corsta College, as well as Jonathan Haynes, who is an RN, also available for questions, and Mr. Andre Francois, who's the president of USW Local 8751 School Bus Drivers Union. And then we also have Camilla Drummond Forrester, who's the director of Open Circle at the Wellesley Centers for Women, and then we'll be followed by public testimony. I would like to ask my colleagues if either of them have public testimony to or opening statements to offer. Councillor Flynn. Councillor Flynn, opening testimony, or Councillor Campbell?
Good afternoon, Councillor Asabi George. Thank you for your leadership on this important issue. Thank you. It's good to be with you. It's good to be with the Superintendent of Schools and the Boston Teachers Union as well. I want to say thank you to the teachers especially, and our BPS staff that are working tirelessly during this very difficult time in our city and our country, but we're so fortunate in Boston to have dedicated.
Oh, you just went muted, Ed. Oh, Councillor Flynn, we lost you there for a second. You're in and out.
That play a critical role in our city. I'm looking forward to hearing the testimony, and again, want to say thank you to Councillor Asabi George.
Thank you, Councillor Flynn. Councillor Campbell, and then Councillor O'Malley, welcome.
Thank you, Councillor Asabi George, for your leadership here. And thank you, of course, to all of the staff, administrators at BPS for being here. Thank you, of course, to Jessica as well for your leadership. And for all the folks who have sent testimony, emailed testimony with respect to this critical issue. I look forward to listening, asking some questions. Obviously, we're in the midst of a pandemic. None of us have been in this before. We have to figure out a lot of moving pieces. So I appreciate everyone's work here. I think for me, particularly as a district counselor, there is how do we protect our teachers in some of the old infrastructure and buildings that we have, while also, of course, listening to our families, our teachers, our educators, and our students with respect to our special needs students and those who really are desperately in need of in-person instruction. So want to do everything I can to support our educators, to support our teachers, our students, our families, our staff. And I just think we just have to do a little bit better. I think, you know, some of this feels a little reactive. I know there have been a lot of folks with a lot of great ideas on the table for some time. And so I'm just looking forward to hopefully getting to a place where everyone feels like their needs are being met. And of course, with respect to remote learning, making sure that all of our families and students have access to hardware, software, and everything they need to have an excellent remote learning experience. So thank you all for your leadership. I know it's not an easy time, and I do my best. I just want to say this. I think Councillor Asabi George does a great job too as the chair of this committee to not create an us versus them atmosphere, which can be really difficult to do in this time. So thank you, Councillor Asabi George, for your leadership, and thank you all again. Looking forward to the conversation.
Thank you, Councillor Campbell. Councillor O'Malley?
Thank you, Madam Chair. Thank you for your leadership in this space. And it's great to see so many friends and colleagues here, particularly my favorite former principal in District 6, Mr. DB, who's now doing some great work in central office. Obviously, we all stand completely united to do everything we can to make sure that we have the safest and most effective atmosphere for our kids, for our BPS families, for our teachers, for our staff. This is an unimaginably difficult year that we have been dealt as it relates to doing everything we can, working collectively, which is what we all share. At the end of the day, we may have some different ideas on how to get there, but we all want what is best for our kids, for our BPS families, and for our BPS school community. So forward to continuing the work. And Madam Chair, I'd be remiss if I didn't also add my voice to acknowledge the incredible work you've done here in a very, very difficult time, in a very, very thankless way. And both as a mom and a teacher and a city official, you've really done some exemplary work. So thank you for that. Thank you. And I will turn the camera off. As you can see, I have a little associate with me for a little bit, and she's being very quiet right now. So
Future BPS student.
future BPS student, you better believe it, Sue. So thanks, everybody.
I love it. Thank you, Counselor O'Malley. And I love Counselor O'Malley using his dad calming voice tone, because that baby Margot must have been asleep. I also want to thank all of our panelists for being here today and continuing this conversation on the reopening of the Boston Public Schools during the COVID-19 pandemic. This pandemic has taught us a great deal about what is and what isn't working in our schools, and about our resiliency and the complexity of this issue as we work on it as a district community. As we move forward, I hope to take every opportunity to provide support to our students, our families, our teachers, and staff across the district. We know that this pandemic is creating an enormous amount of stress, and everyone's mental health has been compromised as a result of this. But we also know that school is often a place of stability for our highest need students, that there are long-term health and well-being consequences from delaying in-person learning, particularly to our youngest learners and many special education students. This pandemic is bringing to the forefront many seemingly competing priorities. We need in-person learning, but we must maintain social distancing and reduce community spread. We must respond to the changing pandemic in real time, but provide stability to our families and our community. We need more social and emotional supports, but our students must have opportunities to academically advance. It is not easy to balance all of these needs. What is clear from our experience thus far is that we must be communicating more openly about the existing issues in our district and work together with the same goal in mind: safe in-person learning for as many students as possible, while keeping the risk to our staff and families as low as possible. I'm certain that this will not be the last hearing. I actually am very certain about it, because we have a number of other hearings upcoming. But I hope that we will use this as an opportunity to learn from our mistakes and our successes during the 3 weeks of reopened schools, and now during this time of full remote learning. I'm very grateful to everyone who has joined us today, to the panel, and also want to recognize that we've been also joined by Counselor Mejia. I'll now turn it over to the superintendent for her remarks and presentation. Superintendent Cassellius.
Thank you, Madam Chair, members of the committee, counselors, and all who are joining us this afternoon for a conversation about our fabulous Boston Public Schools. I'm very proud to and humbled to be leading this organization and the education of our many, many children in the city, especially during this really challenging time. I want to thank my team who is here with me today, who has really been working around the clock. I just couldn't do it without all of them, as you'll see by their dedication and commitment to this city, as well as the children and families that live here. Before I start, I want to just be brief and take just a few moments to thank the mayor and his team as well for their leadership and support, especially Chief Martinez, who's been just an incredible support to me and a guide and providing all of the science behind a lot of the decision-making that we're making in this COVID crisis. I also want to thank President Tang and her members for their support, and really all of the unions of Boston Public Schools for their work with us as we are continuing to evolve and deal with these uncertain times that we have, and just getting it right for our kids as we open and close and hopefully really soon open again, if we can all help to get our kids back in school. So let me just recap a little bit about where we've been and where we're going and some of our plans. I'll be brief, and then so we have a lot more time for questions. So, we've already talked a little bit with you, and I'm sure you've been following the news about where we're at in terms of preparing our buildings, our cleaning, our sanitizing, disinfecting, and the hard work of our custodial staff and facility staff, and fixing windows, distributing our PPE, and all of the different support systems that we've been putting in to get our bathrooms ready, our water supply lines, and just making sure that we have all our cleaning protocols in place for the safety and health of our communities. We've had a very busy summer also of hiring. We've hired 929 new teachers, 50 additional nurses, 25 additional custodians, 65 social workers, 48 family liaisons, and 41 transformation instructional coaches. This is part of the budget that you helped us all pass, and the supports that you've given to us already that really have set us up, and multi-year supports really, because the prior year you had given so much funding around nurses, and that's just set Boston in a really good position with this COVID crisis. Had we not had those nurses, I think we would be not in a good place right now. So I thank that you for your forethought and especially your leadership, Madam Chair, in securing those nurses. And one thing that we have really been doing as part of our strategic agenda is to ensure that we are diversifying our workforce as well. So we're proud to say that over 50% or more of our new hires are people of color, and 100% of our family liaisons are persons of color. And I think 78% of our social workers are persons of color. And so we are really excited about those numbers. And I believe our number is, and we'll get it for you 100%, don't hold me to it, but I think it's over 40% also are linguistically diverse. So we are not only looking for racial diversity, but also linguistic diversity. So that I want to take a moment to thank our recruitment team under Sarah Daly's leadership, and that has been moved into our strategic and equity office, which really has moved into the superintendent's office and given it new juice, so to speak, in order to create a lot more focus on this critical work ahead of us. We've also been working with our current staff on a leave policy that's responsible to the needs of our team and responsive to this COVID crisis. At present, we have 437 employees on leave, 166 are on maternity and paternity leave or parental leave. 98 have personal illness, 67 have a family member who has medical needs, 16 for health reasons, and 29 personal reasons. 51 leave of requests are pending as of 10/20/2020. For our students, we started remotely on the 21st, as you know. And October 1st, we welcome back our students. It was a really wonderful day, who are high in-person priority students for 2 days a week of in-person learning. And we identified those students having high needs as those who need attention with special education. Our public day schools, students who are in substantially separate classrooms and receive additional hours of behavioral services and supports. Students with limited or interrupted formal education, often known as life students, students experiencing homelessness, and students in care of the Department of Children and Families, as well as our English language learners, level 1 and 2, many of which are whom are new to the country and who need these added services in order to really develop their academic skills in the later years as well. So approximately 2,600 students were learning on those cohort days, 2 days a week. And that meant about 1,300 on any given day, either on a Monday or Tuesday, because we were doing remote on Wednesdays, or Thursdays and Fridays. Since then, we had plans to welcome back students to 4 days a week. But as you know, our rates have gone up to a level that we did not feel was acceptable at a 4.7 rate. Now, currently, as you know, we're at 6.2. And we were planning to also phase in our youngest students at that time, grades K0 through grade 3. And we had to push that back now. So what we are going to do moving forward, though, is look for 2-week intervals so that we can look at trends. So if we're at 4 or below, we will begin to welcome back all students. And if we are 5 or below 5, we will begin to broaden our supports for students with disabilities to 4 days a week. Currently, we are working on plans right now for students to come back, our day school students to come back this Thursday, because we think that we can do it safely, and we're going to put in additional safety precautions for them to be able to do so. And we're also working on plans for next week to bring back more students in the categories that I shared earlier, who we deem high need and whose parents say that they are needing this type of service for their children. And we will be working with the BTU to, and are currently working with the BTU to devise those plans and buildings that we believe are safe, have large capacity rooms for social distancing, as well as any additional PPE or HEPA filter fans and other precautions, testing our staff and more regularly so that we can ensure that it's a safe environment for returning those students, even when we have higher numbers. It's extremely heartbreaking for us not to be able to provide these to our students, and it's been very challenging and difficult to speak with the parents who are just really desperate for this care for their children, and ensuring that they have what they need. The Special Education Advisory Council has been working with us every step of the way, and very urgently pressing for us to get this right. So we are continuing those meetings as we're headed into these next several days and weeks. Next, I'd like to just speak quickly about the shift to remote, and recognizing that some of the students who are needing this level of in-person care are going to be able to get that kind of care that they need. And our school leaders are also really working with us to help students access the buildings, to make sure that they can pick up any medications or any other items that maybe they have left or are still needed for them for their at-home learning. Teachers will continue to use their classrooms. We have about 25% of our teachers who are choosing to use their professional spaces, or they may be co-teaching and collaborating with another colleague. And so they are asking, and we will continue to sanitize the classrooms and make sure that they're secure and safe for our staff who are still willing and wanting to use those spaces. Switching gears to food service, we still have our super sites, and we will continue to move all meals to those sites, and also continue our one-to-one service delivery to families that need that. We know that students also need access to the internet and to our Chromebooks. This was earlier a source of major frustration for us as we waited for our supplies to come in. Like many other districts, we're competing for the same resources for our students. And so there was a delay in getting all of our Chromebooks. But as of today, we have delivered or distributed 46,411 Chromebooks. The number of Chromebooks assigned to students is 37,628. And our students without a device is 13,381. That's because some students have opted out of requesting a device, and we have about 5,032 students who have opted out of receiving a device. And then there are a number of students without a device who have not opted out, and that number is at 8,349. Those are a total of we have a total of about 5,600 hotspots that are assigned to students. And we are continuing to add more of those hotspots. We also have partnered with the city, and we're distributing 3,000 vouchers for free Wi-Fi from Comcast to many of our students that don't have access to the internet. But my message here is that any student who needs a Chromebook or needs Wi-Fi, please have them reach out to their teachers or to a principal, school leader, or to the district, and we will absolutely get you one and get that situation rectified. There should not be any situation where they do not have a Chromebook. Also, next, we want to be able to, I already talked about, I have on my notes here, talk about the rates of the consecutive weeks, and I want to make sure that I got that in, but I've told you how we would go back and return to school. But I want to take a moment here to recognize, of course, the incredible work and the stories that I'm hearing about the incredible work of our teachers and our school leaders and staff who've all worked super hard this summer to improve the structure of remote learning. We're getting ready to do another deep dive into that now that we've shifted back into remote learning with our school leaders to share best practices and collaborate that best practice from school to school and across our schools to make sure that we're holding ourselves accountable for a high level of fidelity across the school district, and that no teacher feels alone, and that they can have the support that they need in order to deliver high quality and excellent education through the remote means. Because we know that, you know, remote is not like being in person and having children right in front of you. But it is what we have right now. It is our reality. And so we need to make the best of it. And the best way to do that is to have teachers learning from other teachers. And we're going to continue to find ways to do that. And so I want to kind of finally end with just saying, every time I get a chance to talk publicly, I want to just give a reminder out that we are not going to be able to bring our children back to school unless we all follow the public health guidance. And we really do need everyone to take this extremely serious. It was just yesterday that we were all beeping and having these horns go off in our apartments and on our phones and on our televisions and in our on our smartwatches. You know, that Boston is a city that is on the watch now, and we have to really be diligent in washing our hands and wearing our mask and practice safe distancing and not gathering. And with the holidays coming, being extremely careful that you're getting tested more regularly so that you can gather or be next to your family safely during the holidays. So it'll be really important that you go and get tested so that we can bring our children back as soon as possible and in the safest way possible. So with that, Madam Chair, I'd like to turn it back over to you and take my team and I take any questions that you have.
Thank you, Superintendent. I wasn't sure if Mary or Tammy or Suzanne were also going to offer any formal remarks, or are they also just here to answer questions?
Just questions.
Okay, so I'm going to move. I'm actually, before we get to questions from the council, I'd like to just welcome the second panel and the third panel to also offer testimony, so we can just ask questions all at once. I think it'll create a little bit more efficiency and will keep us at a better time. So I'd like to introduce President Tang to offer remarks.
Sure. Hi, thank you. Thank you for having us here today. And by us, I mean the 10,000 members of the Boston Teachers Union that I'm representing. So I'm sorry, I'm a little taken aback because I heard the superintendent say that the day schools are coming back on Thursday, and that's the first I have heard that being said publicly. And I don't think that our educators in those schools even know that right now. So that's of concern to me.
To clarify, that's the Horseman and the Carter School.
Okay, right. And even those two schools, I'm not sure that we have, well, first of all, we have no agreement on that. And so I want to maybe start, I'm going to rewind a little bit.
Okay, thank you. Thank you.
But so I want to be very clear that from the start, our educators have always wanted to be back in our schools as quickly as possible in person in safe environments. And that continues to be our goal. And that has been what we've advocated for since March. And so since March, we've advocated for the focus groups for educators to come together and learn about the best practices from the spring when everybody was diving into remote practices overnight. We had advocated in the spring for our special needs students to continue to get evaluations, assessments, and in-person services where possible in the safest facilities as possible. And we had extended our help and support to be able to come up with plans that unfortunately were not taken, and then continued through the summer to again advocate for a phased-in approach. We advocated for professional development, for technology, for Wi-Fi, I'm sorry, not Wi-Fi, the technology skills, including the remote learning during this time, and also curriculum development, SELWELL, social emotional learning and wellness. Apologize if I use acronyms, and please do stop me if I use one unintentionally without explaining it. And anti-bias curriculum, culturally relevant pedagogy. We had also advocated for a better hybrid plan. And so we said very early on that because we heard this from our focus groups in the spring, that it would not make sense to have both teachers providing in-person and remote learning at the exact same time. We had said that you should not spend money on $800, $900 cameras for everybody because simultaneous was not a good plan moving forward. And we specifically said that instead we should be advocating for those funds and using those funds to ensure safety and health, because that has to come first if we have students coming back into our schools. And we had said it would be better use of our funds to buy air purifiers with HEPA filters, particularly for our high need students who couldn't socially distance, couldn't wear masks, and had additional health concerns too. We also gave a proposal actually in August for our alternate hybrid proposal that would have ensured that our highest need students are able to come back sooner. We also advocated in our MOA for the district to identify safe facilities so the assessments and evaluations could happen as soon as possible. We, before the 4% number hit, had advocated that we get a proposal from BPS so that we could work out a way that high need students could continue to get services. We continue to advocate for that and have been hoping to get a comprehensive proposal for how we can do that moving forward, which is why I was very alarmed to hear that the superintendent just said that the Horseman and Carter schools would be back in person on Thursday, because that's not something that we have discussed. We literally just met last night. So that's the first I'm hearing of that. And so I think, I can get into great detail of what we've been advocating for. We have had many, many proposals that we've shared with the district and have continued to share with the district through September and October before we got to this place. And when the district violated the agreement about the 4%, again, before that even happened, we were trying to get something in place for our high need students before that even could happen. But I think what my greatest concern is at this point is the insufficiency of the current plan in BPS, both in terms of health and safety, and also in terms of the instructional approach of simultaneous education. I am extremely concerned also by the stifling and, in fact, direct direction from the district not to come up with flexible creative schedules during this time. And that was something we've been advocating very hard for. Again, to give credit where credit's due, we did get the MOA passed, the second one that allowed for flexibilities, and that is what we should continue to be working on and ensuring that that flexibility and creativity is being used so that our students in person and remote get the best quality education possible. But I continue to be concerned with the lack of transparency. Those leave numbers, we've been asking for them. That's the first I've heard of them that we just got right now. We've been asking for a better process for our leaves. We did not want to lose teachers who were high risk and could, in creative schedules, be able to continue to teach remotely while also providing better quality instruction for remote learners, while those who were able to opt in to in-person were able to do so, but again, with the safest environments possible. And so I'll end by saying that we absolutely do believe that there are ways that the district can and should support all of our students, including our in-person high needs students. And that what we've said all along is that we need safe facilities and safe environments. And for the 35 schools that do have HVAC systems, that they should have the MERV 13 filters. If their systems are too old to handle the MERV 13 filters that filter out the virus, then we need to have air purifiers with the HEPA filters in them. Same with the districts and the schools that, sorry, not the district, the schools that don't have HVAC systems, that HEPA air purifiers, again, were something that should have been purchased months ago. So that, as we knew, when fall happens, the weather gets colder, and the plan of just having windows open and fans was not going to be sustainable long-term, and nor was a good plan, particularly for our highest needs students, many of whom have asthma and other conditions that even just open windows of pollen are problematic for. So again, the solutions have always been air quality and air ventilation needs to be addressed. Independent air quality or independent air quality inspections need to happen so that we can ensure that the major way that the virus is transmitted is being mitigated. We have asked for adequate PPE. Even up until October 1st, we know that some of the school nurses were delivered the wrong PPE that was not medical grade masks. And when we had at that point, 7, I think it's over 10 now cases of COVID cases, it was absolutely a dangerous situation where nurses did not have the medical grade masks that they were supposed to have for the students who might be COVID suspected for COVID, or educators or staff members actually. And at that time, we knew that the windows weren't sufficient. So again, it was too cold in a lot of our classrooms. And the third piece is not just the air quality, the ventilation, and the PPE, but again, that the instruction that was happening was not sufficient. The simultaneous instruction was not in the best interest of our in-person students or our remote learners. And we needed creative, better schedules and better staffing situations so that we could better meet the needs of all of our students. And then the fourth piece is that, again, there was an agreement from BPHC. They were the ones who recommended the 4% number that all students go remote, and it be optional for staff to go in. That if staff were taking these high risks, again, it had to be optional too. And so we had, again, on August 27th, presented a plan where the district should survey individually schools to find out how many students were really needed for in-person and would opt into that. And then how many staff could opt into, again, with the condition of putting health and safety and mitigating those concerns first. And so that continues to be our advocacy. And we have always wanted to see a plan that, again, address both the instruction, the pedagogy, lowering the risks of, again, schools during the remote hybrid time. Again, I repeat these things because I don't think everyone realizes that we had schools with maybe 20 or 30 HIPP students, but over 100 staff coming in and teaching remotely in cold, poorly ventilated classrooms. And that was just not a plan that we could get behind and continue to condone, because we never condoned that in first place. And there was always an opportunity to have a better plan. And that's what we continue to advocate for, a better, safer plan. You're muted.
I don't know if you want, but I mean, I don't want to get into, the conversations that continue to go back and forth with the BTU. I don't find that productive use of time for the
So
council.
what I think we'll do is we do have some additional panelists to offer some testimony today, and then we'll go to questions from the council, which may include some questions that reference any of and all of the public testimony that's been offered, that will be offered by the panelists today. I also want to note that we've been joined by Councilor Breeden. Lauren O'Malley Singh, did you have a presentation?
I have a statement.
Great, perfect. And then we'll have, after you, we'll have Mr. Francois, I saw him on here somewhere, also do his remarks. Thank you, Lauren. Welcome.
Okay. Thank you. Thank you for this opportunity to speak on tonight's panel. I'll be speaking as a BPS nurse, a BPS parent, a BPS spouse, and an essential worker. Nothing I say tonight is in disparagement of our nurses, bus drivers, custodians, secretaries, teachers, principals, and administrative staff who have been working tirelessly to maintain safety on a daily basis. None, and I mean none, of this would be possible without our school communities coming together with the best interests of our children in mind. Everything I say tonight is with a singular intention and goal for student and staff health and safety, socio-emotional well-being, and academic achievement. My experience with school closure in March and reopening plans was very challenging. As far as school reopening conversations go, there was very little dialogue between BPS school-based nurses and district level leaders in health services. BPS school-based nurses attempted to initiate dialogue starting in March of 2020 through present and continue to be largely ignored. Myself and my colleagues inquired on a regular basis about protocols, procedures, and measures to ensure as safe a reopening as possible. We inquired how and when all staff would be fitted for N95 respirators, given respiratory transmission, and my understanding of OSHA guidelines of a safe workplace includes providing appropriate PPE to employees for the pathogens they will be exposed to. My first request for an N95 respirator fitting was on March 12th. Decisions made at the district level were not informed by school-based nurses. This not only feels like a huge opportunity missed, I mean, how many people can say they have a virtual STEM think tank at their disposal full of educators and healthcare professionals, yet fail to include them in the reopening process by in any substantive way? It is important to note, because school-based nurses, as well as STEM educators, have intricate scientific foundational understandings of our buildings in terms of ventilation and air quality, as well as the logistics within our communities. We all know a protocol, policy, or safety measure is only as good as its adherability. I, along with many of my nurse colleagues, participated in BTU BPS agreed upon safety walkthroughs. My school's first walkthrough accumulated 3 checks on the roughly 50 item checklist for safety. My school's second walkthrough accumulated a few more, but nothing close to safe prior to school reopening to students. Despite this glaring issue of inadequate ventilation and filtration, BPS chose to reopen anyway. Mayor Walsh even went as far to say that BPS buildings have adequate ventilation. This statement is baseless and misleading to myself as an employee. I do not want to be let in unsafely into my workplace, and as a parent of a child in the district and a spouse of an employee in the district. We all know that HEPA filtration and MERV 15 filters are the public health recommendations for airborne transmission. The reopening process itself was unnecessarily terrifying, quite honestly. I had not personally been fitted for my N95 in time to know if the 5 N95s I received in a lunch bag would fit my face in case of emergency. As Jessica said, none of our schools have been supplied with surgical masks. We were given paper masks, which are not FDA approved. They are not in accordance with DESI guidelines. They're face masks. They're truly paper, no filtering capabilities, and they're ineffective in preventing respiratory transmission of diseases. I've requested the appropriate masks since October 15th. I was told they were at the bowling building. I offered to go there and pick them up, and then I was told they were in a vendor's warehouse. I have no idea where these masks are, and that's scary. I was told I would receive supplies from my medical waiting room. I have not received these supplies yet. I requested them again on October 15th. I've heard nothing. A nursing colleague of mine experienced the first positive case of COVID-19 in the building, or learning of that knowledge inside of the building, and it resulted in that school-based nurse reaching out to health services for triaging support. I want to return to the philosophy I mentioned earlier, that a policy, procedure, or safety measure is only as good as its adherability. There was no district level guidance on what procedure to follow if a staff or student is positive and in a building. I requested this protocol from the district on October 8th. I still haven't received an answer. I would be remiss if I didn't also share that the mayor was aware of this entire situation on the eve of opening, despite going above 4% positivity rate in the city. I feel betrayed as a citizen. As a BPS parent, I'll share my experience via notification of my daughter Uma's principal that there was a COVID-19 case in their school. This announcement came without any other guidance. No what's next, no next steps. I emailed and asked if the school's open or not the next day. I received no answer. I emailed Dr. Casilius this question. I received no answer. Just as Dr. Casilius reminds us in her opening statement, we need to adhere to public health recommendations, and this applies to us as BPS. As the days, weeks, and months go by, we have learned more about COVID-19 that needs our attention as a city. Independent air quality tests to determine baseline air quality in our buildings. COVID-19 is airborne. This means the size of COVID-19 respiratory particulates can be as small as 0.3 microns. That automatically tells us that adequate air filtration would include MERV 15, which is no longer MERV 13, that would not capture that tiny of a particulate, out into our HVAC systems that have filters. And we need to have portable HEPA filters in every other space that doesn't. We also know that airborne transmitted diseases are only prevented through N95 mask wearing. Fabric masks do not prevent transmission of airborne respiratory disease. Its potential to be airborne increases, it potentiates in poorly ventilated buildings. We know that we have poorly ventilated buildings. COVID-19 in its airborne state remains suspended in the air for hours at a time and can travel beyond 6 feet. Brief encounters throughout a day constitute close contact. The CDC just published a study that was astounding. And the CDC guidelines are now guiding us towards redefining what a close contact is. And it changes our entire, the entire map of what our schools are going to look like in terms of safety. I request again that we continue to follow CDC guidelines, not just DESE guidelines. Jeff Riley is not a public health expert. He is not a medical professional. He's not an infectious diseases professional. Why he put his name on a document that says a window with a box fan is adequate ventilation, I don't know. What we need to do is get the appropriate ventilation into the buildings. Another CDC guideline that is coming down the pike that we need to be prepared for is in-school testing. Massachusetts will be receiving 2 million rapid antigen tests to be issued in schools. That testing requires particular competencies for the person administering the test. It requires a certification. I'm begging Dr. Casilius to look into immediately the certification for us school nurses to perform this rapid testing. It is within our scope of practice. I would like to continue to request that we are reviewing our best practices on a regular basis with a STEM think tank, so we can reevaluate, revise, and renavigate as we see our numbers trend up or trend down, hopefully continue trend down. And that is what I'd like to say tonight. Thank you so much for this opportunity.
Thank you very much, Lauren. Andre Francois, are you with us? Mr. Francois, are you with us?
Yes, good evening.
If you'd like to give brief remarks, that would be wonderful. Thank you.
Thank you, Madam Chair. Thank you for having me. We represent almost 900 drivers in Boston and about 50 drivers in Randolph. And I appreciate you having me on the panel. Unlike some people in the city don't recognize the job the bus drivers are doing. We're still transporting the student of Boston, and we're proud to do that. As you know, since back in March, when the pandemic hits and we had the shutdown, we had 4 people that died, plus the management staff. And we came out, we tell everybody that we're not going to have one more death anymore in the place there. So we, despite all the problems the company was giving us, the private company that we work for, giving us, we took in our own hands the health and safety of our membership. And we're doing a pretty good job so far, although we have some positive testing in the bus yards, and after that, so from there, we continue to fight the company with the bad practice, with unsafe behaviors, and very, very careless about the whole health and an issue of people. But I have to say that we've been lied to, and the parents of of the children of Boston been lied to by BPS, by the company, by even the city that tell everybody that each bus girl is going to have a bus monitor on it to ensure health and safety of the children of Boston. They lie on that one. Everybody was telling us that we were going to have a bus monitor. We were going to have a pretty safe bus with extra masks and PPE available for kids that have no mask coming on the bus with no mask. And just recently, in the reopening here, we were having drivers threatened with discipline if they weren't picking up any kids with masks, without masks. So they forced the drivers to pick up kids without masks. So they go from lying to each bus will have a bus monitor on it. That was a lie. And then thankfully the mayor actually worked something out and give us some extra standby. We could have some extra adult on the bus, on each of the bus if we finish to cover the BPS routes. So that again, they didn't follow. They didn't follow on the bus. I don't know if they were trying to save money on the backs of health and safety. So they didn't do what they had to do with the extra standby that they have. And then before school reopening, there was they give us a walk to some bus yard down on Washington Street. So they did a dog and pony show that day. They have a bunch of professional people dressing with nice suits and everything and showing us that they're cleaning the buses and everything else. When school started, all these professionals disappeared. We saw a bunch of kids at the Freeport yard and at the Washington Street yard, except for maybe Reedville that had some professionals still that showing up. But other than that, it's a bunch of kids with little crate running behind them with little towels in them and squirt bottles, filling those buses with a bunch of mist on top and not wiping it down or nothing like that. So it's a bunch of lies, very careless company. A company that was already depleted with no management in it at all. Finally, they bought a guy from the MBTA, from the casino, that has nothing to do with experience on school bus transportation. Instead of having us, let us help him with some stuff, he's doing union busting all over the place, telling us all types of lies and not implement care about safety of our people. Beside the 4 people we have dead to COVID-19, plus the management staff. Down at the Wheatville garage, right before school started, we had 2 mechanics tested positive. And not only they didn't want to tell anybody about that, they didn't report it right. They didn't do any track and trace. They didn't quarantine anybody. The places still say not disinfecting properly, and they don't do any disinfecting in the bus yard at all for the buses. So right now I'm talking to you now, there is a standby. When they bring all the standby for just a little bit of work, they force all the standby to show up in the workplace, gathered in a very tight place where now people, we have one driver that tested COVID positive, one standby driver among the standby drivers. And then they didn't even report that right. They didn't even tell the drivers where the standby driver were working. Was it a driver or a bus monitor? The same thing happened when the bus monitor was tested positive in the bus yard. They didn't even do anything about that. Get anybody to do tests, track and trace. They didn't quarantine anyone, so they don't care. They just go ahead and treat us like we don't exist, or we're a bunch of animals. We can do these things, but they don't worry about the kids that we were. They didn't even ask the guy that tested positive the other day if he went out on a wood to go tell the parents of the children or the school that this guy here that drove on Tuesday or that drove on Monday just tested positive on Thursday. So you might want to take a look at this and that. So I can sit here and tell you a whole bunch of stuff that's going wrong with the reopening. All the lies that they did to the people. They even give a little video showing how a monitor will work on the bus. We'll have the mask on. We'll do all the disinfecting and stuff like that. They even use our driver's force to lie to people and everything. It's terrible. It's right now we need those monitors to be a second set of adults on the bus to continue to implement health and safety for the people. We can't continue like that. If you're talking about reopening school, you really have to take a look at the job you do with the bus drivers and the bus monitors and then the bus yard as a whole, the disinfecting and everything else. So the number of standby that the mayor allow was for a couple of reasons. Not only to use extra ones as a bus monitor, because we realized after a while there was not enough bus monitor for sure. And then they were telling people that if you don't have a bus that require a bus monitor, you have to go pick up children like that. And a bus driver, they know all too well, a bus driver cannot be a bus driver and a bus monitor at the same time. For the kids that have challenged special needs, that will get off the seat, walk around and take their mask off. And we had a whole bunch of problems like that. So this is unacceptable. We don't want to accept it. And I'm glad I get to come here to testify about this, to let people know that all this good stuff they told him at the beginning was a bunch of lies. And none of it happening. Besides giving the drivers a bad bid, real bad bid with a bunch of errors, bunch of mistakes in it, telling you your start date is this much, and then it's November 2nd, your start date is November 16th, and then they calling everybody to come in to get COVID, to put you at risk. It's very bad what they're doing, and then it's unacceptable. So we want the city to be at peace. That's why you didn't hear us any sooner, because we're all in this COVID thing there. I hope everybody is well, and we got to protect ourselves, and we got to stay alive in this pandemic. So
thank you very much, Mr. Francois, for your testimony. I think that we'll have a pretty robust conversation after we get through our last panelist who's here to speak. Ms. Camilla Drummond is with us, and Camilla, is it Camilla?
Camilla, thank you for asking.
Yeah, you're very welcome, and appreciate your testimony today. Welcome.
Thank you, Madam Chair, and members of the committee for allowing me to have an opportunity to just share the importance of centering social and emotional learning during this time. I'll tell you a little bit about myself and then jump right into what I have to say. So I'm a resident of Boston. Specifically, I'm a resident of Hyde Park. I'm a mother of 4. My eldest is at Boston Latin Academy. I'm also a graduate of the Boston Public School System. I'm the director of the Open Circle, which is a program of Wellesley Centers for Women located at Wellesley College. This is a social and emotional learning program that has been providing professional development for over 30 years to educators and grade differentiated curriculum around social and emotional learning. I'm also a lead facilitator with the National SEED Project. SEED stands for Seeking Educational Equity and Diversity. In this role, I facilitate conversations with educators from across the country, parents, as well as workplace staff on issues related to racial equity, social justice, and systems of oppression. I'm a board and steering committee member for the statewide social and emotional learning committee, SEL for Mass, Social Learning Alliance, as well as a steering committee member for the Social and Emotional Learning Providers Council, whose membership includes over 100 providers across the country. So we all know this, but I'll just say it. There's been and continues to be emotional upheaval for all of us on this call and all of our children. Shifts in schooling, loss of family and friends to COVID, loss of social and physical connection to friends, shifts in daily routines, food insecurity, connectivity and technological instability, racism, and illness have all created a consistent and persistent sense of uncertainty. Whether learning is happening in a school building or virtually, social and emotional learning needs to remain a priority. SEL involves developing children's skills for recognizing and managing emotions such as empathy, self-awareness, social awareness, self-management, relationship skills, and responsible decision-making are some of the competency areas that enable children to understand themselves on a deeper level and engage in healthy relationships with others. It calls for building positive relationships and problem solving while helping schools develop communities where students feel safe, empowered, and cared for. A quote that we use at Open Circle often in our professional development is that kids don't care what you know until they know that you care. So you can have the best content area experts in your school district or in your school buildings, but if students do not feel that they are in a space where the adults, the educators, or school community in their network are truly invested in their safety and in their overall well-being, that child will not learn to their full potential. If this didn't feel critical before, I think we can all agree that it's certainly critical now. In a recent article that I published in the Hettinger Report, I mentioned that at the beginning of the health crisis in the spring, when schools and districts were suddenly met with the need to transition abruptly to remote learning, the emotional and social well-being of students they served was front and center. 8 months later, the need to center the social and emotional well-being of our children is just as critical. We are all dealing with intense and multi-layered loss and grief, and our children are feeling it just as intensely as the adults who care for them. SEL might previously have been viewed by some as a nice add-on to the academics during the school day. The current crisis has shown us beyond a shadow of a doubt that SEL is the very foundation teaching and learning should be built on. Relationships matter, as does centering those relationships in authentic ways. There's lots of research that I could quote, and I think many of you probably are aware of it, that talks about the benefits of SEL. So I'm actually going to skip over that part. There's been, data from 2011, 2015, as well as currently around the importance of centering social and emotional learning and the collective trauma and individual trauma that our children are experiencing, and the greater need for social and emotional supports. Some of the work of my colleague, Dr. Karen Craddock and Dr. Amy Banks highlights that the brain registers pain of social exclusion, isolation, and marginalization in the exact same way it registers physical pain. I wanted to bring this up because it's very important given what we are all dealing with this pandemic. The need to transition to remote learning, the need to have social distancing is causing actual pain for our children and for many of the adults who care for them. I will forward some resources from my colleague around how to use a model to really operationalize how to help students around this pain that they are experiencing around social marginalization and social exclusion. Lastly, no conversation about the well-being of students can occur without a simultaneous conversation about the psychosocial well-being of educators and administrators. We cannot expect our children's SEL needs to be met with care and concern if the adults charged with that task are stressed and uncared for themselves. Empty vessels cannot fill others up. Educators have been going above and beyond in this current climate, and their wellness matters too and should be centered. Are there things that can be taken off of their plate so that they can focus on the support we have just been talking about for themselves and for their students? How is the district poised to offer and create spaces that center adult SEL and healing? Self-care is something that is big, that is being talked about often, but self-care cannot occur without community care. And we must develop and maintain policies and practices in district that center the well-being of educators and the decision makers. We must shift the focus on standardized testing and evaluations and offer a more humanistic approach to teaching, learning, and partnering. This is certainly a difficult and complex time, and it is an opportunity to center what should have been foundational from the start, the social and emotional wellness of students, teachers, and their families. Thank you.
Thank you very much. And I think that it was very fitting to end sort of the formal presentation before we get into the discussion, talking about and centering us on our emotional well-being, all of us. And I especially appreciate the added to the end, because we know that certainly the social and emotional well-being of our students is so critically important, in their families, certainly our teachers and our educators and building staff, but then also those that are the decision makers. And I recently participated in an interview for elected officials around sort of dealing with the stress and dealing with the challenges of this time. And for those that are making these decisions and talking about creating policies and in negotiation and in conversation, not necessarily working directly with students, those decisions do create a great deal of stress. So I appreciate that everyone here today on this panel that's involved in this discussion is managing a great deal of stress. And this has taken an emotional toll on everyone: Superintendent, President Tang, staff members, city councilors, just all of us. And we truly are in this together. And I think that today's conversation will have some discussion, we'll have some, perhaps some disagreement. We've had some disagreement. And I think that as long as we are centering the child in these discussions and filling our cups and filling our, that we will, my hope is get through this. So I want to open it up to questions, but for my colleagues, and I think that it is important to give this an opportunity first. And instead of asking questions this round for myself, we'll give the superintendent an opportunity to respond to some of the concerns that were shared here today, and in this opening round. So Superintendent, please take this opportunity to respond. We'll spend a few minutes on this, and then I'll go to colleagues in order of arrival for a direct question. Thank you.
Well, thank you, Madam Chair and President Tang, Ms. Drummond, and Mr. Francois, as well as Ms. O'Malley Singh, for your comments. Obviously, they're very hard to hear and to really try to think through all of that. I have my staff who is also responding and giving me some of the background, but I would like to first have my staff invited to be on the call. I know there are a number of things to respond to here, but the first thing is that, I'm very ambitious in getting my special ed students back into school. Listening to them tell their stories of the regression that's happening for our children is just heart-wrenching. I was speaking with SpedPAC, and there was a parent literally sobbing on the call, so in pain for her child to come back to school. And the further delay that we continue fussing with one another is not productive for our children and getting them back to where they need to be safely. So I know weeks ago we ordered the HEPA filters at the really request of the BTU to really try to, have that as an extra safety measure. Truly, the CDC does not require fans even in the classrooms. We did that as a better way to get the air flowing quicker and exhausting out of the windows, but it is not required, just one window. And I know that has not been sufficient, but we did have independent air contractors come in, and every single one of our spaces was cleared under that independent air quality, and those can be found on our website. And I think it's really important for the public to see that that air quality test was done by an independent air quality contractor who came in. We are doing another one once we have more students in the buildings, but as you know, we only had 1,300 students attending over, 125 schools, which averaged about 10 students per school. And we also had no school with more than 60 kids at any one time. And most times, most of our schools were running less than 25 students in them at that time that we had our kids in person. So we are working in an environment in which we are doing our best to serve our kids with the highest needs. And Jessica and I really worked hard on a shared proposal to bring back our students and then to let the other teachers go work from home remotely. And each of those schools were developing plans and putting in plans in place to be able to do so. And we have approved, I think, 9 at this time for schools who have worked together. And there were a number of schools who had already worked together on that process of not having everybody in the building. So I commend those school leaders for doing that, and for Jessica and her team working with my team in order to get that moving. I also wanted to address the PPE. The mayor and EMT services have just been terrific getting the PPE out to our nurses and our staff. I know that we had, I think, 3 nurses who were fit multiple times and could not get an N95 to fit correctly. I myself went and visited the nurses at the Orchard Gardens School, who are 2 terrific, amazing nurses there, super creative and wonderfully loving. They did, both of them their petite women could not fit into an N95 mask. I called up the chief of staff, the mayor's chief of staff. Next day, they were out there fitting them with multiple masks to make sure that they had been fitted. And so, I know that Miss O'Malley Singh says that she sent me an email. I pride myself in trying to get back to everybody within 24 hours. And I don't recall getting an email from her. It could have gone to the superintendent's email box rather than to me personally. And so I want to encourage her to email me directly, because we do try to run those things down as fast as we possibly can. Also, she brought up DESE rapid testing. I was on a call with the commissioner today. They are offering this testing. I don't think it's available just yet. So I did sign up for us to get more information about it, because anytime we could do that would be great. We have been offering multiple testing for our teachers for many weeks now. Matter of fact, the first week we did it, we only had 7 teachers show up. The second week, I think we had less than 100. And so we've been continuing. We invited 1,000. And still, I think we only had something like 200 and something. Don't quote me on that, but it's been very low turnout for what we've been offering. So we keep on trying to find ways to, and it's just a drive-through. You drive up. The Red Sox have been really wonderful to partner with us on that effort, and Chief Martinez. So we plan on doing testing with when we do this reopening of our schools for high priority of our staff weekly, to make sure that they are getting the testing that they need. And so we've been working on that plan and making it more accessible. I think they moved to Roxbury College, so it could be more centrally located even, and having a location there, not to mention the 20 sites that we have across Boston, and the free mobile sites that are up constantly, and any teacher can go and get tested there too. And we very much encourage that. So we'll continue to get information out and work with the BTU on getting our staff tested. I also wanted to mention about our facilities. We did our walkthroughs a few weeks before we started having in person, there were a number of things that were lifted up that our facilities team really did work to try to resolve, which we resolved many of those. We did not resolve the stickers. Some of those we've had to use tape and other things for those pieces. But I think that the major things were resolved with the air quality outside testing and the independent inspections that were done by the city as well, which all passed as well. As for the heat, we are asking our teachers not to have a lot of windows open. You know, CDC guidance, whether we like it or not, they're saying one window open is adequate, and our external testing says that it's adequate. We don't need to have, you know, 3, 4, or 5 of those big windows that are typically in our buildings opened up, and we are raising our heat, which normally is at 72 degrees to 76 degrees, and we're keeping it on at longer hours than we typically have for our winter. Obviously, no one's in our buildings right now, but when winter does come, we want to be sure to monitor our heat and regulate our temperatures to make sure that people are comfortable and it's not crazy cold in there. I mean, certainly we don't want that to be the case. And I'm trying to think, and I just want to mention quickly, and then I'll just take questions about the social emotional learning and the really importance. You know, we hear teachers and school leaders talking about Maslow before Bloom. People don't probably know those two individuals, but it's really about focusing on the social emotional health and the well-being of all of us, and understanding that we are in the midst of a really difficult time, as you mentioned, Madam Chair, of this pandemic. And it is very exhausting for all of us, many people working around the clock. And the fact that Susan Salter Bennett, who has been our chief nurse, because our nurse has been sick and unfortunately passed away, our head nurse, and Suzanne has stepped in and worked and guided and been just there for us as the reflection of our nurses, and has been meeting with our nurses. And so I just want the public to know that we have had the chief nurse at the table guiding us and working closely with the Boston Health Commission and Dr. Lowe at the city, working with us. And I just really do want the public to know that we have used science, we have guided it, and our chief head nurse has been working and meeting with the nurses regularly on this. And it's just, I believe, doesn't give credit where credit is due to the hardworking staff of who have been working on this, and our facility staff and our custodial staff, who has been short-staffed for many, many years. As you know, you helped us with increasing 25 custodians. You'll probably see us come with more for next year because it's just not enough. They've been understaffed for many years, and they're working their tails off. And it's just, you know, this is an infectious disease. You know, our facilities are old and they're ugly sometimes, right? The paint is chipping off. But that you don't get a COVID from paint chipping off. You don't get COVID from dust on a ventilator. You get COVID because someone doesn't wear a mask. You get COVID because people don't come into the school well. They come in when they're sick, and that's just not okay. And so, you know, our schools are safe, and have been safe, and have been proven to not be spreading. It is the behavior of us adults who are not adhering to the health guidance is the reason why we spread this disease. And so I just want to kind of say that. I think it's important to know that. And I know everyone is fearful and there's a lot of anxiety, and I acknowledge that. I really acknowledge that. But our buildings are old, but we are told by the professionals that our air quality is safe. And we are told by the professionals that they have been inspected and safe. And so I felt like it's important to say that. And I felt it's also important to acknowledge the incredible hard work of everyone who has been working in their best interest of our children, especially our children who are special needs. And I think it does a disservice not to acknowledge their incredible hard work. And that goes without saying, the incredible hard work of our teachers to really understand a whole new way to teach remotely, and the incredible hours they're putting in supporting families in ways that they haven't had to support them before. I know that puts a undue burden on them to do social work services and help them secure housing when they're evicted, or, you know, help them get their electricity turned on, or whatever it is. This is a big stress on all of us, and it has been so challenging to lean into this work and to try to just do what we've never done before. And so I appreciate the support of the council. I appreciate the support of all of the staff of BPS, and trying to work together to get this done. I'll turn it over for questions.
Thank you very much, Superintendent Casalius. I would like to go to Counselor Campbell, as I know she has a time restriction, and then we'll go to Ed Flynn, Counselor Flynn, for questions. Counselor Campbell.
Thank you, Madam Chair, and thank you, Counselor Flynn, for your flexibility. And thank you all for the presentation. I will tell you, I was getting a bit frustrated because, you know, at the end of the day, parents, educators, teachers, community-based organizations that want to partner with us want to know what the plan is, right? They want specifics, they want a timeline. And so while I hear us talking about what might be working and going well, you know, respectfully, Superintendent, there are parts that have not gone well. And I think we need to own some of that. And I think, you know, I was just on a meeting with a group of parents at the Sarah Greenwood School, talking about the infrastructure in that building. And there are major concerns as to whether or not teachers, principals, and students should be in there. And they actually had infrastructure concerns, of course, before COVID. Even though the CDC has guidance, good for them, it changes every single day. I think in this moment in time in which people are talking about their children, educators, of course, are concerned about their own families, that we have to go above and beyond, and maybe above and beyond CDC guidance, to ensure that people feel safe. And I just think we have to do better in that regard. And you know, if I'm a parent tuning into this presentation or this council meeting, I'm frustrated because I haven't heard enough about what is the plan to deliver a in-person instruction for my special needs student, for example, who is struggling. What is the plan to make sure that educators and teachers and staff are in buildings and in buildings that are the safest? You know, it sounds like there's 30 or 35 buildings where we all agree those might be the safest, in the least old, where we could, you know, improve the HVAC systems, meet some of the requests of our nurses and our teachers, and some of the PPE concerns, to immediately make sure that those buildings are available, while figuring out what we're going to do with some of this older infrastructure, where it's not just teachers that don't feel safe, parents are extremely concerned. And this meeting with the Greenwood School was just last week. So I have 5 questions, and I apologize in advance, I have to jump to another meeting related to BPS and exam schools. The first is this whole digital divide. Obviously, with remote learning, we need to make sure our young people have and families access to hardware. So some of the numbers suggest that, you know, there are still some families without devices. I know we want them to reach out to us. It's difficult for parents to do that. So how might we proactively reach out to them to make sure that we're closing that divide? Number one. The second question I have is around the infrastructure piece. You know, what are the buildings that are the safest right now for us to phase back in, when appropriate, in-person instruction in the district? The third question is, and this is extremely important, I can't read another painful email from a parent or even a teacher with respect to special needs students who require in-person instruction, an IEP analysis, et cetera. There are some teachers who are still showing up and doing some of that work with their special needs students. Kudos to them, and in some buildings that are not necessarily the best. But what is our plan to immediately implement some type of in-person instruction for our special needs students that absolutely require it? My fourth question is, what is our current mental health supports for our students and educators? This has been an ongoing conversation. Specifically, what are we doing to meet their needs? I appreciated Ms. Drummond's presentation on this. We've been talking about this from the very beginning. We are all experiencing collective trauma. So that's my fourth question. And then my last question is, as we're talking about learning pods and community-based organizations that are already working with families to create learning pods, and usually the wealthier families or those who are in the know have created some creative partnerships. And so is there a formalized system or process where the community partners could be working with us to create more learning pod spaces for our children to work together or have something that they can do on an outside basis, obviously before it gets too cold. But what is the process related to that? And I'll end with this. Right now we know there are families and students who are not learning. And there are disproportionately students of color and low-income students. Clearly other districts, other school districts right here in Massachusetts have figured this out. We need to figure this out. And I think it starts with us starting with where we failed, frankly, where we got it wrong, where we didn't necessarily take the advice or best practices of other people. But we can't continue to have another council hearing where we're talking about the same thing over and over again, raising up the same concerns about the infrastructure, the safety. What does it mean to go above and beyond? So, Madam Chair, those are my 5 questions. Thank you very much.
Thank you, Councilor Campbell. I will add, just before the panelists respond to Councilor Campbell's questions, that Thursday we are having a hearing specific to some of the mental health supports and special ed supports for students, especially during this time. So I want the answer, but I also want to know we'll take a much deeper dive into that piece because it is so critically important. I will also note, just for the record and sort of in relation to Councilor Campbell's last question, that today's hearing is about an update what are the pieces that we have learned, where we've gone wrong, and how we're taking corrective action, and also sort of where are we, a sort of state of the schools during this reopening time. But I appreciate very much your very thoughtful and thorough questions, Councilor Campbell. We'll start with the superintendent, and I know there are others that will probably be able to give greater detail in response.
Yeah, Councilor Campbell, thank you so much. Certainly, technology, I'll start there, has been frustrating for us. And I know you've been an advocate for pointing that out and just the data pieces of it and, getting that digital divide closed. We had some procurement and issues, some supply issues, competing for that technology. Even though we had ordered it a long time ago, getting it across seas and in our hands took longer than what we had hoped for. And then with Wi-Fi, it's just contracting and getting our contract with the city and with Comcast and getting that done just took a lot. And it actually took the mayor's involvement of, making some phone calls for us to move that faster so that we could get that out. And then getting our hotspots out as well. And we have more now. The state secured some hotspots as well that we are hoping to be able to get. So hoping to be able to move some of those things quicker and to put those in place. But any child that does need a computer, or we should have plenty on hand to be able to give that to that child. So please keep lifting those up. As for the Sarah Greenwood, I think our staff was on that call with you. And, it is an older building, or a building that's in need of some look. And I think that what they want is a new building. And so we continue to assess in our Build PPS the priorities of our school buildings and where they're at and the work to be able to do there. So I know that our staff provided updates and answers to you and to the community at Sarah Greenwood. As for the special needs students, I can't agree with you more. I talked a little bit about that, and getting the plan in place has to happen soon. We are really hoping to get our kids back to school right away, as soon as possible. It appears that I have to do some more discussion with the union on that. So we'll get to task on doing that. And then as for learning pods, I'll finally say there, and then I don't know if my staff wants to raise their hand if there's anything that I missed that they want to add. But with learning plans, we've been working with Boston After School and Beyond. We are in the midst of really trying to raise about $12 million to be able to expand to about 6,000 children, learning pods that would serve them for the out of school time if they've chosen the 2 days a week option, so that they'd have care those other 3 days. So is anyone on my staff wanting to say anything on any of those items? You can raise your hand or unmute.
Dr. Casellas, I can also add some points about technology. So as you mentioned, a lot of our Chromebooks, we have ordered 60,000 devices since the start of COVID, the vast majority of those being in and obviously being delivered to both schools and students. Going more specifically about students that don't have a device, one of the things that we've started over the last 2 weeks is adding a component to our system to track opt-outs. We know that a significant number of families have opted out of taking a district device. I have 2 family members, my niece and nephew are BPS students, and they have opted out of taking a Chromebook. So they're within that category, but they're attending every day. And what we're doing behind the scenes is listing out all of our students that meet certain criteria. The first being low attendance as reported by the classroom teacher. The second is low online activity. And more than just our learning applications, but are they actually logging into things like YouTube and logging into their Google account in general?
Sorry, Mark, I just have to apologize in advance. I had a hard stop. I'm actually already late. I have to jump onto another BPS related meeting related to exam schools. But I will follow up and listen to the hearing. I try to put all my questions out there, so I will follow up, but didn't want to be rude and jump. And Madam Chair can continue to get responses through everyone. But thank you so much, Mark, and thank you, Superintendent.
Thank you, Counselor.
Very good, Counselor Campbell. Thank you very much. But yeah, we'll continue to answer those questions, please.
And I'll just wrap up very quickly. So when we look at the number of students that do not have a device and are not attending school and are not logging into their account at all, the number is significantly lower. We're actually looking at a number of around 700 or 800 students that fit that category, with the majority of them being either under grade 3, where we would typically see a student logging in under their parent's computer or the parent's account, or in a special education program where they may not have the same ability to log in online. So that is one of the reasons why it's more important to look at both online activity and teacher attendance when we're looking and tracking who needs access online. As the superintendent has mentioned, if any parent still has a need for technology, whether or not that is Wi-Fi or a device, we have the ability and means to meet that need. And we do want to make sure that we continue to keep up with our parents and our schools' requests.
Great, thank you very much, Mark, and thank you for your continued effort to work with our students to get the devices in their hands. Does anyone else have anything to add to some of those, to the response? Great, thank you very much. Councillor Flynn.
Mary, I would like for Mary to speak and clarify our special ed planning.
Oh, very good. All right, Mary.
Yeah, I would like to speak too on those points. I thought you meant just to the BPS team.
Oh, no, I'm sorry, anybody. Yeah, we'll go to Mary and then we'll go to Jessica.
Great, thank you. I just wanted to follow up to add a little bit of additional detail to the superintendent's opening remarks around the work our team is doing around preparations to bring some of our highest need students back to in-person learning and services as soon as possible. So from an operational standpoint, when you think about transportation or meal service, our building preparations, we are using this Thursday as a starting point that we're aiming for and that we are ready for from an operational standpoint to serve students in person. Obviously, we know it's far more complex and requires, to the superintendent's point, close collaboration with the staff and leaders, the families of those school communities before we would have those students return to buildings. So similar, I think, to BT President Tang's point, though we are operationally ready for this Thursday, we know that we still need to have those staff members and family members have a lot more collaboration around the plan so that it is co-constructed with them, in addition to just ensuring that our operational pieces are in place. So those foundational operational pieces are ready, but we are not intending to have students in buildings 2 days from now, just to build upon and clarify both of those 2 points.
Thank you very much, Mary. Jessica.
Mary, I greatly appreciate your clarification because I'm not going to lie, my earlier remarks, I was completely thrown off and stunned when I heard the superintendent say that students are returning this Thursday, because as we have been meeting. I just checked with the staff at those two schools and they were not aware of that, and nor were the school leaders at those schools. And so that was quite alarming to me. And so I really appreciate that clarification. And I will just reiterate that we have always wanted all of our students, honestly, it is much harder to teach remotely and during this pandemic than it is in person. That's what we're trained to do as educators, is to teach in person, and we want to be in person with our students. But it has always been that we need to have a better, safer plan. Again, safer in terms of not just what the CDC may say is sufficient in terms of an open window, but actually going above and beyond, maybe an open window, particularly with cold weather and rain and snow, and having the HEPA air purifiers that we think would be better. And so it's not what we can do, it's what we should do, and what is the best plan possible that we can come up with and co-construct, as Mary shared, with our educators, our families, and our students. And that is the work that I thought we had been engaging in. So that's why that came as such a shock to me when I heard that, and threw me off. And I do want to also take a step back and give appreciation to everyone who has been working so hard. I know for myself and our team and for our educators, it's really been nonstop since March. And so I know that's the case also with folks who've been working in central office and in BPS in the city, that since March, when school buildings closed, and we dove into remote learning, that we literally have not had a break because it's just been planning. With that being said, as much as I do think that everyone is well-intended and has been working as hard as they possibly can, that does not mean necessarily that the plans that have been laid out or executed have been successful nor sufficient. And so we must do better. We must do better for our students. We must do better for our educators who are trusting us to also keep them safe. Not just our educators, but our bus monitors, our lunch monitors, our bus drivers, and everyone. I think we were deeply heartbroken that 4 bus drivers passed away this spring. I don't know how that wasn't bigger news. And that is our goal, is that one death is one too many. It's not something that I can live with. And I don't think it's something that anyone should be able to live with, that they didn't do everything in their power to ensure that our students and adults are safe. And the one also area that I think, not just for the facilities and PPE in terms of keeping everyone safe, is the testing. And I do want to appreciate the Red Sox Foundation for helping to provide the testing at the Red Sox facilities on Tuesdays between 4 and 7, but that is just not sufficient right now. And so we need to have better access to testing. Some teachers actually they were scheduled to go get tested when they were still teaching, because some of our schools don't end until 4:30 or later. And so we've got to have a better system for testing, not just for our educators and staff, but also for our students too. And relying just on Tuesdays between 4 and 7 for teachers who live all across the city and outside the city. It is not an easy thing to get to Fenway between 4 and 7, especially if you've been teaching until 5. So I just think that's an area for improvement as well. And again, we want to see our students back in school too. There's nothing more rewarding than teachers and educators being with their students in person, but it has got to be in the safest possible environment with the best conditions and the best instructional approach too. And again, the simultaneous approach is not one that is successful for our remote students or in-person students, and we need to have better plans.
Great, thank you so much, President Tang. Anyone else to respond to Councilor Campbell's questions? There's a lot in there. I appreciate
I just want to remind that it's now at Roxbury College. So I wanted
the testing has now moved to Roxbury Community College?
Yes.
On Tuesdays, 4 to 7, just so.
I think it's still that. Let me double check with my staff.
Yes, it is.
Sam's got it. Perfect. 4 to 7, CC. Perfect. Thank
we'll
you.
make sure, Jessica, that it gets out again. I know it was just switched to be more centrally located and make it more accessible.
Great, thank you, Superintendent. Counselor Flynn.
Thank you. Thank you, Councilor Sabi George. I'll try to be brief as I can. When schools do open and students are back and teachers and staff are back, custodians are back, what is the process in terms of testing for students, for staff and nurses? But what happens when someone does test positive at the school? What type of contract tracing takes place? What is the notification process? And what impact would that eventually have on, school continuing at that school building or going remote or a combination of the two? What's the latest on that issue?
Thank you, Councilor Flynn. I'm going to ask Suzanne Salter-Bennett to respond because she works so closely with the Boston Health Commission on this contract tracing.
Thank you, Superintendent, and thank you, Madam Chair, and Councilor Flynn for the opportunity. Currently, when we are notified of a positive case or, whether it's within a building or previously in a building, we work with the school leaders, depending if it's student or staff, work with the school-based nurses and the school-based team to determine what level of contact that individual has had within the school building during the infectious period for COVID-19. And that infectious period begins 2 days prior to symptom onset if someone is sick, and 2 days prior to test collection if the individual is asymptomatic without having symptoms. Once we go through that process, once we, we work with the adult individual. If it's an adult, we work with family members, nurse, school leaders for students. Once we determine their infectious period, we interview them based on, information that we've, received or from the Health Commission in terms of what contact they've had, who they were closest to, where they sit, or how often, whether they were in the building or whether they were working remotely part of the day, et cetera, who they work closely to. And we work through that based on the close contact definition from the CDC, which was just updated. So previously it was, the BPHC, their close contact definition, based on CDC guidance was, close sustained contact for 10 to 15 minutes within 6 feet. And so the CDC and obviously now BPHC have updated that to incorporate the new update, which is 15 minutes cumulative over a 24-hour period. So we work through those scenarios. We work with the individual that tests positive so that we can maintain that individual's privacy. We then work through each one of those days, and with the person, it's typically 1 to 2 days that they may have possibly been in the building, and it's usually before they become symptomatic. And then we report any information that we receive to the Boston Public Health Commission, directly to the Infectious Disease Bureau, to the director over there. And then we work through the entire scenario, give as much information and detail that we can. The determination at that point is made by the BPHC public health officials, who in what scenario and what information that we relayed is considered to be a close contact. And so from that point, health services then works to, if there were close contacts identified, we work through notifying those contacts, providing them information about the recommendations for testing, follow up with their primary care provider, the tips and skills and information about quarantining and the importance of quarantining, the length of time, of the quarantine for a close contact depends on the last time that that individual was in contact with with the positive case. We work through situations where a person tests positive because they have a family member who's positive. We've worked through those situations with students who have tested positive remotely because a family member has tested positive. And we relay all of that information to the Health Commission so that, we can make the best determination by the most qualified people to make that determination. At that point, if the individual is a City of Boston resident, the Boston Public Health Commission Infectious Disease Bureau would continue the contact tracing process. If they are not if they are not a City of Boston resident, then their local Board of Health would take over for the contact tracing action steps. But BPHC would still remain, they would still remain as a contact because of the work site being within the City of Boston. So like I said, we report all of that information to the Health Commission. Once that's all confirmed, we work closely with facilities, their environmental team. We work closely with the Food and Nutrition Services team to ensure that the sites are cleaned appropriately, to make sure that the kitchens, if needed, have additional sanitizing performed to ensure that the kitchens have been sanitized to the standards that they are held to from the Inspectional Services Department. We work with communications to ensure that we're notifying the community of the positive test if the individual was within the building. As an FYI, our letters have information about where to get tested, where to go for questions. They have recommendations for hand washing, mask wearing, and they have our health services phone number for additional questions that we can support with. Sorry, I got too long-winded.
No, I found it very informative because we've had a lot of conversations and discussion around the contact tracing as well, and notification within school communities. Go ahead, Councilor Flynn. I'm sorry I interrupted you.
No, that's okay. Thank you, Suzanne, for that answer. And then my final comment / question is, it's been a very difficult year for everyone, but especially the Asian community, including the Asian community. We had
Councilor Flynn, we lost you there for a second.
We had the first public health meeting in the country practically at Josiah Quincy School in January. And we saw a lot of the discrimination and bullying of the Asian community throughout the country. A lot of mental health challenges as well, language access, high poverty. But factoring all that in, what are we doing as school returns and we go back to remote? What are we doing to address some of these issues that the Asian community has developed or has over the last year? I've noticed it. I'm with them almost every day, and I've seen it firsthand. But what is BPS specifically doing to address some of these challenges? And that's my final question.
Well, thank you, Councilor Flynn. It's such an important conversation to have. And, I met with you in the Asian community just this past Thursday because of some of the painful comments, obviously, that were made. And so, and then also we've worked together on interpretation services and translation services. And then really early on in my tenure here in the district, and some of the bullying around our Asian community, and them feeling, and they told me they felt invisible and left out. And so I've tasked my equity team to work with the community. I know they've met a number of times with the community on a plan of action. And so we'll be working with them on enacting that, and that's around quality translations, in making sure that we have quality and timely translations, making sure that we are inclusive of them and that they get information in their language early and often, and that they're part of it. Also, many times they say that we talk about Black and Latinx, and we don't talk about Asian. So we are going to be very much more deliberate about saying Black, Latinx, and Asian families or children when we discuss that. So a number of those things that our equity office is working on, as well as training within our equity circular and revising our equity analysis and making sure that that's front and center with all of our diversity and reflective of the diversity of the school.
Thank you, Superintendent. That's good to hear. That's important for me to hear. As you know, I represent a large immigrant community, a large Asian community. And so I have a responsibility to them and to all my constituents. I just want to say thank you to BPS. I want to say thank you to BTU and our friends from the Bus Drivers Union as well. Thank you.
Thank you, Councilor Flynn. I think Lauren had something to add to that. Lauren?
Yes, I was just hoping to speak to Councilor Flynn's first question that he asked, which was, what is the protocol and policy of when a staff or student is COVID positive in a school? Suzanne definitely outlined what happens on the district level. She did not outline what school nurses have as a policy, because we don't have one. We don't know, we just know to call health services. That's a very scary position to be in, and I think it's an important distinction because we've already requested a protocol and we have not received one. I would also like to just clarify CDC guidance about open windows. Regardless of the CDC guidance of school reopening plans, I think it's important to just use our science-driven brains to look at what type of PPE and air quality you need for a respiratory airborne transmitted disease, and adding 2 and 2 together, it equals N95 respirators and HEPA filters. And I think the mayor agrees with that because he started sending HEPA filters to our nurse's office. I would love to see him send them to all of the rooms. Thank you.
Thank you, Lauren. Anybody else have something to add?
Can I just briefly share? Thank you, Lauren, too. I was going to ask you for your perspective, too, from the nurse on the school on the ground. But the other issue, and Councilor Flynn, I just want to appreciate that last question. You know, as an Asian American myself, certainly this is something I've been advocating for with the Massachusetts Asian American Educators Association. And we did also reach out to the Equity Office and Achievement Gap Office to raise these concerns as well. And one other, I think, important solution in not just cultural relevant pedagogy and anti-racism training that is inclusive of Black, Latinx, Asian American, Native American, and others is also the implementation of ethnic studies. And so our BTU Ethnic Studies Now committee has been working over a year now on a kind of produced grant to create curriculum that can be implemented. And so the district has committed to a 0.5 position to support this work. And we do hope that the district is going to fill that immediately, but we also hope that it can be a full-time position moving forward because I think that would go a great length from the research we know with ethnic studies in our schools to helping combat racism as well.
Thank you. You've just done a plug for a hearing order that will be before the City Council tomorrow on that ethnic studies curriculum.
Madam Chair, I just want to make
Superintendent, if I could just make sure that Mr. Francois, he's had his hand up for a little bit. I'd like to go to him. We'll go back to you and then we'll continue with questions. Mr. Francois? Sorry, Superintendent. Thank you.
Thank you. This is for me. I mean, Councilor Flynn. I want to thank him for the first question that he asked. Since we as bus drivers, we are an extension of the parents. We are an extension of the schools as well, because we go pick them up first thing. We go drop them off, pick them up to take them home. So when somebody tested positive at the schools, we'd like to have that same benefits down at the bus yards, where we can have the testing, the quarantining, the disinfecting, all the stuff apply. It seems to be like we have forgotten, because at the very first time we've asked for a school nurse to be at each of the bus yard, at least one school nurse to be at each of the bus yard. They ignored us on that one, and then we go into all the problems that we're going with. We'd like to ask for three things: the health and safety protocol be respected, and then having the bus monitors on the bus riding as a second adult to help us out. We'd like to have the third thing is good disinfecting going on. Those are the three important things that we care about, because we don't want anybody died anymore of this thing here. Because the last positive we had is a 66-year-old man that had no business being in the yard when they only had 10 ones going. Like tomorrow on Wednesday they don't have much work, but they wanted all the standby drivers to show up in the bus yard where they can pick up the 14% that's in the contract to cover the work for tomorrow and Thursday. And we just learned also that they were going to have some people coming back, some kids coming back to school in person on Thursday. That was a shocker to us too. But later on they say it's not true. So I hope it's not true, because we're not ready in this pandemic. It's so high that everybody got to stay in. So thank you.
Thank you, Mr. Francois. Superintendent Casalius.
And sorry, Chairwoman Asabi George, I think, I don't know if you remember, we have usually 7 minutes per questions. And I did send a text message and you said that I would be able to do my questions before 6. And I'm just trying to understand your process, because I know.
Yeah, so Councilor Mejia, we can discuss my process. There's only a few counselors, so I gave very extended time because the conversation is very thorough and thoughtful. Questions have been brief, responses have been long and elongated because it's very complex and very detail oriented. And when we only have a few counselors on the hearing, I give quite a great deal of liberty because this conversation is so important.
Okay.
So I do understand that you've got time restraints. If you,
it's okay.
If we can come, we'll hold the rest of the response to Councilor Flynn. If you'd like to ask your questions, I understand like Councilor Campbell had to leave. She'll listen to the rest of her answers. We won't be offended if you have to leave in the midst of that response. So Mr. Taylor and Dr. Casalius, if I could ask you to hold the rest of your response to Councilor Flynn so we can get to Councilor Mejia. Go ahead, Councilor Mejia.
Thank you, Councilor Asabi George. I misunderstood your response when you said that I would be able to do so before 6, so got a little anxious. But I just have a few questions. First of all, thank you for hosting this hearing. Dr. Casalius, I just really want to put out there that, you know, in your comments earlier, you talked about, and I'm not going to assume that the onus is on the individual parents and the people who are putting their children at risk because they're the ones who are, you know, might be coming in contact with the virus, and you know, we might be going shopping and doing things. I just don't want to put the onus on the people who are frontline workers in terms of like why we have been unable to reduce the number of cases. So I just hope that does not land like that for some folks who are listening in, because it could easily be interpreted in some of the comments that you made earlier in terms of the fact that these numbers keep going up. And it's no fault. I know people may not be adhering to the safety protocols, but I just don't want people to have that perception. I'm also curious about testing. It seems like it's something that people can opt into. So I'm just curious, at what point are we going to start doing testing that is not so much of an option, but that it is part of the way we do business? I'm curious about, there's a question, this is a question about process. Something that we have heard time and time again is that parents and guardians feel like they're being kept out of the loop, beyond press conferences, how are parents and guardians informed of the changes about the reopening plan, and not just parents, also educators feel the same? And more importantly, how does BPS track whether or not these stakeholders understand what these changes are? One of the teachers talked about struggling with lesson plans and lesson planning, and I'm just curious, and said there was little ways to centralize curriculum guidance. So I'm just wondering what the administration is doing to make it easier for teachers to design lesson plans in the era of COVID. I'm curious, in May, we heard that 5% of families struggled with quality internet. Has that number changed? I know you mentioned partnerships with Xfinity, wondering what those results have been. I know you mentioned some high need students, such as students who are ELs and students with IEPs. We heard this morning from a parent, a BPS parent, who is an English language learner. Her son is also on an IEP. There are students in Boston who require multiple accommodations, and I'm curious to know how BPS will address these needs. With all of the changes that have been made recently, a lot of students experiencing new normals almost every day, and bouncing off of Counselor Campbell's questions, how are we introducing trauma-informed practices into the classroom? Not just providing therapy and other social services, but literally redesigning lesson plans and our school day to reflect the trauma-informed lens. I feel like we just have been focusing on academics, and I'm really curious about what this looks like in terms of trauma-informed. And with all remote learning being the reality for the future, how are we redesigning school days to reflect the needs of students? I'm thinking about increased break times, more interactive lessons. We saw in the budget cuts to departments like student support and equity strategy. I'm curious to know how those departments are operating given the decrease in funding, but the apparent increase in need for services such as parent support and equity. And overall, you know, I have to say that as we continue to have these ongoing conversations, I am just going to encourage us to always center it on making sure that all the stakeholders, it's like what I'm noticing in the world of politics is that everybody just wants to play along with the people that play along with them, but that's not how we're gonna handle the situation. We need to have real uncomfortable conversations, and whether we agree with people or not, we need to give people an opportunity to voice. And I feel like there's this friction between BPS and the BTU, and we're pitting parents against educators around this narrative about why we're unable to open schools. And I think what it's doing is creating tension unnecessary. And I think that we have an opportunity, if we're really going to move from a place of transparency, we can't continue to do this. It's because of them, it's because of this, it's because of that. At some point, we all are gonna have to take responsibility for the fact that we're not prepared to really create an opportunity for us to send our kids back to school in a way that is safe for all. And I think that is a difficult conversation to have, and we can't trust a system that continues to pit people against each other. And I'm sorry that I have to leave, and I'm so sorry that it took me 30 minutes just to get to this point. And I do appreciate the chair giving me the privilege of speaking. And I will just have to listen to the tape to hear your comments, but I'm late for another 6 o'clock. Thank you so much.
Thank you, Councilor Mejia. So whoever would like to start with some responses to Councilor Mejia's question, we can also continue with the rest of the response, Mr. Taylor, Dr. Cassellius, for Councilor Flynn's questions.
And so the ethnic studies position, I was able to confirm, we had to get some additional information from the academics department, but that position will be posted for sure tomorrow. I know somebody had asked that question. Ray Ketchens is going to speak to what happens, the protocol when staff reports a confirmed case of COVID, and then Sam can speak to what the cleaning protocols are. I know somebody asked, I didn't want people to think we didn't have protocols around when we have confirmed cases of COVID. So Ray?
And I just wanted to mention that if Nurse O'Malley Singh would like the guidance, Suzanne had shared that the guidance is in our reopening document, as well as she can send that out to her, make sure that she has that guidance.
I have it, Dr. Cassellius. It does not address exactly what we do with a child who is positive. What if the child has no ride home? What do we do with them? Who do we call? How do we get them safely out of the building? What do? We don't have that guidance, I assure you, respectfully.
So thank you, Lauren, for that response. I think what may be helpful, and I think,
I'll just have Suzanne give her a call, make sure that we have it all covered.
Right. So I think that that's really important to learn that today. So perhaps if it is in the protocol, it's not clear. And the protocol perhaps just needs to be clarified and amended or modified so that there is an appropriate response, and what our nurses are asking for, they have access to.
Yeah, that too.
So, and I think that that's what's most helpful about having a conversation like this with everybody present, that we can maybe clarify any miscommunications or missing information for that. And I see that now I'm the only counselor on here, so I guess I get to ask all my questions for as long as I want. I know there's additional responses to Counselor Mejia's questions, which were, again, very thorough questions. So I would appreciate those responses, as I know she will review the tape, the film, the video.
Well, why don't I let Ray briefly share what Al wanted, and then
excellent. Thank you. Appreciate that.
Finish on Lynn, and then I'll go right to Counselor Mejia.
Hi. So I just wanted to touch bases on the protocol for staff cases as they're reported. So the health services, we work very closely with Suzanne to report anything that happens like at the school level. But for human capital, we work with the City of Boston's policy to get folks the time they need off, the certification of the period of isolation or quarantine based on the type of exposure that they may have. We get the staff the time that they need off using the FFCRA or their own personal time if they would rather do that. What we also do is touch bases with them to see in unfortunate cases where the time off is more than just the 10 days. We work with them to get the extended absence covered. And on the back end, we work to get the placement backfilled so that there is continuity in learning or in any assignment that the person may be absent from. There is a widely shared document that lists out each of these steps for the employee, for the school leader, or any other person operating in a supervisory capacity so that they're sure about what to do at the onset. And we've also, we were, using individual as contacts, but we've gotten a secure inbox to sort of deploy the COVID response team that we actually use as well. So we have a number of protocols to make sure staff are also taken care of as it relates to reported cases, whether it be remote or folks who are actually working in the building as well.
It also prompts notifications to Sam and the operations team to notify facilities for any appropriate cleaning that needs to be done as well. And then we work with the superintendent's team along with the health commission to determine if it warrants having to close particular areas in a school or a school altogether. So we do have, I just wanted folks to understand we do have protocols when there are confirmed cases of COVID.
Respectfully, again, there is no protocol about if a student takes a bus and they have symptoms, what we do with that child for 6 hours. I'm sorry, I know I'm being terribly disrespectful. I need to nail this down. You need to understand that there's no protocol.
So I appreciate that, Lauren. I think we understand that there needs to be some significant clarification on that protocol and additional detail to that protocol. We've just spent a little bit of time talking about a response to a positive case in a school. I am curious, and we've talked a little bit about testing. I am curious about any efforts to increase the amount of testing that's done across the city and perhaps very specific to schools, whether it's in schools, outside of schools, just in a school parking lot or within, distributed across the city in places where there are lots of schools. So it is easier for the adults in particular in our school buildings to get testing and have it done much more regularly, if not, I'd say weekly for testing. Has there been any work towards that?
Suzanne, could you or Tammy speak to testing and the Boston Health Commission's work around testing of adults and testing of our teachers and the protocols for that and what we're able to do at this time? I know that they have mobile testing across all of Boston, and I think they can test up to 1,500 people in those testing units, as well as we do specific testing on Tuesdays for teachers. That's been available for several weeks now. So I know that that's available. Suzanne, can you speak to the availability of testing, or Ms. Poost?
Superintendent, this is Tammy Poost. I can say, and I can send to anybody who's interested, the mayor's office sent out just 2 days ago another email blast that went to every employee of BPS, detailing with a map of where the 30 free testing sites are throughout the city. There's an availability of over 1,800 testing opportunities per day that anybody can go to. And again, there's no cost. So that is something that's available to all members of the community. With regard to the testing that we're offering to our own staff, we agreed, and again, I know the superintendent mentioned this earlier, the Red Sox Foundation made available to us 300 tests per week that we have been pushing out to and allowing BTU members to sign up for. There has been some changes to that program over time to try and make it more convenient for them. We've also included more than just BTU members now because of the there's still capacity to get more tests done versus the numbers of people showing up. And so we are looking at how to do that on a basis that is driven by the science. Right now, the science would say that testing shouldn't be happening every week. And instead, and Suzanne, correct me if I'm wrong here, we're looking at a 2-week basis because of the incubation period for the actual virus, that testing every week would be repetitive and not giving you the symptomology enough time to show up with regard to then having the test be positive when they should be. So right now, the tests that we offer to the BTU members are available to take every 2 weeks if in fact they want to.
So can I respond, please? Because that's—
Can I just see if Suzanne Salter-Bennett has anything to add to that?
Yeah, Tammy, I think you're speaking to what Chief Martinez had outlined and what Dr. Lowe in terms of the program for, for the protocol for that. If someone has tested positive or has tested recently, they recommend, moving to the next test cycle, not that one. There's like criteria for that testing. For the Fenway BTU testing. I'm not closely involved with that. That is was worked specifically through the Health Commission. But the other piece, just in terms of testing that is being made available through the HHS and through DESE that, that the superintendent spoke to a bit earlier. The rapid testing does require, there are stipulations about how that rapid testing would be set through. So it's not, while we would still, obviously participate in running through the program, it does not offer, it's not recommended or it's not meant to be utilized for asymptomatic individuals. Unless there is a close contact, I believe. And then the other piece is that they would have to have some type of minimal symptom. And then if the test is positive, it would need to be followed up with a PCR that the nasal swab, the anterior nasal swab for the confirmation testing. And if they're symptomatic and it's negative, it would also require a PCR follow-up, just based on my understanding from how that process has been explained to me from BPHC. Those rapid testing, so I think we'll have to, go into those scenarios a little bit, deeper. We want to avoid a situation where we're asking a parent for permission to test, and then we're testing and then it's negative, but in reality, the student would probably still need to go home at that point. And then we have the situation where we're then telling the parent that the student's test was negative and there may be some confusion. So I think we still need to run through that program and, participate in all of the training and information that the state is offering in relation to that specific student program for testing.
You're muted, Counselor Sabi George.
Thank you. Jessica and then Jonathan.
Okay, thank you. So I just had a few responses. So one, I know that the city has had free testing sites and the district has repeatedly said that that's open to any, but I just want to point out that, I've been using those free testing sites, and it is not so easy to just, when you're teaching throughout the day, to go to one of these sites. They're only open from certain hours, which are usually during the teaching hours. One day I tried to get a test at one site. There was a line of 20 people. I could not wait that long for that line. I went to another site. There was another line. I went to a third site that I thought was there that was no longer there. Then I ended up not being able to get a test that day. And so I just don't think that those free testing sites are sufficient for what we need right now in terms of, again, safety for our educators going into schools. And also want to reiterate that it can't just be for the educators, it needs to be for the students too. They need to also be able to get tests. And I think it didn't quite rub me the right way when the superintendent had shared earlier that it's the fault of the adults for the positive test cases in the district right now. First of all, there are students who've tested positive too. And we wouldn't really know where the virus came from because students are not being regularly tested. So I don't think that's what the superintendent meant, but I just wanted to clarify that I don't think we should be blaming educators for any positive cases in our school communities. Also, those individual cases in school communities were supposed to, and according to our MOA, which the district and city agreed to, be reported on a dashboard publicly on the BPS website. And it's not supposed to be a citywide, it's supposed to be based on individual schools. And the response has been, oh, well, we want to protect identity, but our schools are big enough that if you say there's a positive case in the community, no one knows if it's a staff member, a student, or a parent, or someone else affiliated with the school. And so I don't think that that should be an issue. And we maintain that the district needs to make available that information by individual school. Another comment quickly is that it's news to me that the Red Sox testing is now available every 2 weeks for B2 members. And I find that concerning, an example of our frustration with the communication. I am the president of the Boston Teachers Union, and if testing is now available to all of our members every 2 weeks, I should probably know that so that I can communicate that to my members. And would gladly do so. And this is an example, though, of a frustration in transparency and communication and getting information that our educators need in order to take advantage of the opportunities. And so while Lauren may think that her comment was disrespectful, I don't think it is. Again, I think that everyone has the best of intentions. I always assume best intentions, but if your policy or practice is not being implemented in a way that is going to actually get the information needed to the people who need it, then I think it's important to reflect on where that communication line is breaking down and how to better get that information to the people who need it, including us at the union, who are working really hard to advocate for not just our educators, but also our students and families as well. And that brings me to Councilor Mejia's comment about, yes, we have had disagreements with the district. And yes, we do feel like that the district has been throwing us under the bus and blaming the union for the inadequacy of plans. And despite the fact that we've shared our own solutions and plans for months now that have been disregarded and ignored by the district. And I'm not saying that to, cause any more tension, because I truly don't want that. I've always wanted for us to work collaboratively and just most importantly, have those of us who are on the grounds working in schools, who are actually interacting with our students and families, to be able to inform the plans of the district so that the plans are better and again, safer. And so I would just greatly appreciate if, in meetings and public forums, et cetera, that the excuse of, oh, we need to talk to the union about it, or it's a labor issue, that's not done, because it's not helping all of us work collaboratively together. And it's also creating this narrative that for some reason that we can't serve high need students because of the union. And that's just not true. We've literally been advocating since March for our highest need students and in-person services and safe places. And so I had to say that.
Thank you, Jessica. Jonathan?
Thank you, Counselor. I'm going way back to Counselor Flynn's question and Suzanne's response, because I think I want to bring out a couple of things, and I thank Suzanne for bringing up the fact that CDC has changed their definition of close contact, because it's really that's a very important thing to understand when we look at questions like contact tracing and ventilation issues. Because based on new understanding of the disease and aerosol spread of the disease, the CDC is now saying, as Suzanne pointed out, that contact over an extended period of time is the same as close contact for 15 minutes within 6 feet. And I think that has two implications for us that we need to think about in terms of reopening. And the first is that we really need to know where students and staff are throughout the day. Because basically, if you're in a classroom with someone who 2 days later is found to be COVID positive, we need to know who was in that classroom. Because if you were in the classroom for an extended period of time, no matter, it doesn't make any difference whether you're within 6 feet or not, you've been exposed. And so the contact tracing is much more complicated, and something we need to take and that's something we need to take into account and update our protocols around that, because I don't think the protocols were written with that understanding, because that just recently came out. And secondly, I think that in terms of ventilation questions, it's not a question of a window opening or somebody even an outside agency coming in and giving us the green light to go ahead. The question as put forward by the Harvard Chan School of Public Health is, how many air exchanges are you getting in a room in every hour? And the gold standard of air exchange in a room is 6 air exchanges per hour. That means that 6 times in an hour, the air is completely recirculating. If you look at some of the pictures that were posted by members of the Boston Teachers Union recently, you'll see that we have these big window fans with windows that don't open all the way. That means that half of the air that fan is doing is going out, and half of the air is half of the dirty air is being recirculated back in. It's also important in terms of looking at the MERV filters, because if the MERV filters aren't taking out the air, the dirty air, then that dirty air is just being recycled by the HVAC systems. So it is true that in order to get those 6 air exchanges per hour, you probably do need to open a lot of windows in the classroom. And also we need to there is a way to measure that. There's a device called a balometer, and it actually can be placed in a room and measure what the air exchange rate is. And air exchange rate is the real issue, not what DESE says about it, because we saw what Commissioner Riley thinks about safety today with his comments, but there's actually a science behind it. And so to say, I think that we need to take into account that science and put the resources into really finding out whether or not these rooms are safe or not, because it's not just a matter of what DESE says, it's actually a matter of how many air exchanges are you getting in an hour in any given situation. So one window may be enough, but in another room it may well not be enough. And so I think we need to again focus on the science in a real way, not just that somebody said that this is sort of the bottom line. And I'll take another minute just to say that I think in general we need to be working from the precautionary principle. And the precautionary principle in science is that you don't need to prove harm in order to take precaution. It's not up to the Boston Teachers Union to prove that people are dying. in our schools. It's up to us all together to work to do the things that are the most cautious and that go beyond what we can prove in a you can't experiment on people. We can't have there's no experimentation that can happen. You can't put people in rooms and say we're not going to circulate the air in this room and we are going to circulate the air in another room. We need to do whatever is the most cautious thing, and that's not what's been happening. And so I hope that what we can unite around, because I think the point of this hearing is about trying to unite, is to unite around using the precautionary principle, which says that we don't need to prove harm. We need to take those actions that prevent harm.
Thank you very much, Jonathan. Anyone else for a response to either Councilor Flynn or Councilor Mejia's, or maybe I asked a question in there somewhere. So just if we could just wrap up the testing question and the contract tracing question. I'm not sure why we just can't simply test in schools. I feel that there should be a way to even do testing on site, whether it's in partnership with our community health centers and other healthcare providers, in partnership with Boston EMS, in partnership with Boston Fires. I think both EMS and fire are trained to do testing. I think that that's something that we should explore, and whether it's weekly or every other week, I feel that that's something that we should be able to look at doing for, as part of our return to school plan, because it is important that we get back to school pretty quickly. I don't know if anyone's got a response, or if there's any opportunity to do in school on-site testing.
Counselor, just really quickly, I appreciated Nurse Haynes's comments, and I forgot to mention earlier too that although there have been air quality tests in our schools, that our experts have told us that those tests are not reliable measures because nobody were in the buildings at the time in which those air quality tests happened. And reliable air quality tests actually, to be able to measure the CO2 exchanges that Nurse Haynes was talking about, you need actually people in those places. And so that's another concern that we have, and why we've asked for follow-up air quality testing, particularly in the places there that there'll be people in them, where there are people in them.
I can respond to that, Councilor Asabi George.
Thank you, Sam.
I just wanted to note that going into the school reopening plan, we knew every year we conducted 2 environmental audits a year that goes really into depth about the quality of environment conditions in the building. And we went into that knowing that doing these type of tests now are not the best indicator, but it's an indicator, right? So in order for us to verify that our buildings are safe as they were, we felt compelled to make sure we let the community buildings were safe and the air has been tested, and we agreed to it with BTU. So I think it was a decision that we made collectively, and I think we honored that commitment. We found that the levels, were more than acceptable in the school. So I just wanted to note that point.
Great, thank you very much for that. I'm wondering if we could talk about sort of I think we've touched on this just a little bit. But
Counselor, I'm so sorry. I don't mean to interrupt, but I just need to follow up too that the previous tests, we've looked at the data too, and even the schools that had HVAC, there were about only 10 of the 35 schools that had at least 1 or 0 rooms with less than 1,000 ppms. And so that was another reason for concern around air quality, even for the schools that did have HVAC systems. So I just wanted to share that too.
So if we could all, go ahead, Sam.
Sure, yeah, I just wanted to know, we tested all schools in all administrative buildings. And for the schools, we tested about 7,300 different sites. And all those readings came back well within acceptable levels and ranges. So I just wanted to call that number out.
Yes, I understand that, but it was when there wasn't anyone in the buildings. And so we can go back and forth. But I think, again, what Nurse Haynes's point is if there's a way to ensure that with people in the buildings that we can do additional tests, why wouldn't we?
I'm going to punctuate that.
We plan on doing that once folks are back in, and we're going to start our run very soon. It's going to encompass that testing. So our goal is always to wait till the next level of phases to do that. to make sure that there are people in the building to get the more accurate readings.
Right.
And I want to punctuate that we were asked to do those tests prior to people coming into the building. So we did that and honored that commitment because we were asked to do that. And we have multiple other times points that we will go and do additional testing, but we are not in the buildings right now. So we're postponing that additional testing at this time until we do have kids that back in the buildings.
So I think that we've demonstrated that we can go back and forth, that we can go back and forth for quite a bit, because this is important work to all of us. And we're all, obviously, everyone is very passionate, not just about this topic, but about our kids and getting our kids back to school. Can we, so let's just, if we could just shift gears for a few moments, and I think that we do have a few people for public testimony. I want to get to that, but can we talk a little bit about what's next? So what are the steps that we're taking today to reopen schools soon? Also considering the infection rate, the positivity percentage, but the work that still remains to be done. What are we doing to get back to school, to get back to in-person school, utilizing this time where our schools are empty? Are we learning from other school communities that are in school, in person, in school right now? What are the things that they're doing that we could replicate? What are the lessons that we've learned either from our own work or from other school districts' work to get to a place where we're open? How is that informing sort of the work going forward? Because a lot of this conversation today has been the sort of the history, the recent history, and how we ended up at this point today. And I think that we've had a healthy dialogue, a great deal of criticism, I think, back and forth. That's fine. But now let's talk about the forward movement. What are we doing together to reopen our schools, to reopen them safely, and to make sure that our kids are getting the things that they need from us, from the adults?
Well, thank you for that, Madam Chair. There's a lot of work that has to get done in order to continue to work forward. Of course, this is uncertain. This continues to change. Our conditions continue to change. We were at 4% before, and now we're at, the state saying 6%, and then we're at 5% for high needs kids. And, just these measures and what is not safe. We heard Nurse Jonathan talking about the air quality and the new CDC guidance and what's happening with, the air and discrepancies between what was and what is, and how that changes and how you have to adapt. Now about air quality, and is it good with them in or not with them in? We can't get them in, but we want to test the air before they go in. So there's just a lot of discussion that has to happen to come to some common ground about what are the conditions in which people will feel safe. And there are 50% of the people who just feel safe no matter what you do. That's just the way it is. We have 50% of families choosing not to go back to school because they just don't feel that it's safe for their child to do so. And I think if we really were all honest, many people feel very unsafe at this moment in a grocery store, in any public space, because of the surge that's happening. So planning for the contingencies are just extremely complex in a very large district like Boston Public Schools, where we just have transportation, you cannot flip. You've heard, Mr. Francois talk about, transportation and the many precautions that are needed there for cleaning them, and then staffing them, and staffing with the monitors, and making sure that kids have the proper PPE, and making sure they're not, on a street corner, waiting for a bus. So I think that there's just a number of things with that. Then there's the facility pieces, and, going into the winter and making sure that we're adequately preparing for that piece. But right now, the very first thing that's on our minds and has been on our minds for the past week and a half to 2 weeks, especially, is how are we going to get our special needs students the services they need as soon as possible. And we just need to get these agreements with the union and the principals, because the facilities are ready, especially for our therapeutic day schools. Once we get those resolved, I think we can get our kids back to school who are our highest need students. And so that's what we need to get. That's my very next step. That's the step we're going to take. And we're still, several weeks out from everybody else coming back because we have to have those 2 weeks of trends in order to bring everybody back. And that has to be below 4. And unfortunately, across this nation and right here in Boston, we're not seeing those numbers trending in the right direction. And I didn't mean any disrespect to any adult or any Boston Public School employee. I was not directing it to any Boston Public School employee. I'm directing that to all of us adults in this community. All of us have to adhere to the mask wearing, to the hand washing. I am just appealing to the community to take the public health guidance seriously, because that's how community spread happens. I see people playing soccer and basketball. I know we want to all go out. I see people gathering. Those are the things that are going to spread this disease, and that's just how it is. So I don't want my comments taken or being misconstrued, and I appreciate Councilor Mejia bringing that up, and for you, Madam Chair, bringing it up, and Jessica as well. I'm not disrespecting any one individual person. It's all of us, a whole community, to bring our children back safely.
Thank you for that. Go ahead, President Tang.
So I think we are on the same page, certainly, about wanting to bring down rates in our communities and everyone's responsibility to wear masks, et cetera. But I respectfully have to disagree that our buildings are ready. I do think the Carter School is in better shape and that there is less to be done there to ensure the air ventilation and filtration. But the Horace Mann is in the Jackson Mann building, and that has been slated by BPS actually to be closed. And to be closed because it's one of the worst facilities in the whole district. And it is, while it does have HVAC system, it is also one of the older HVAC systems that cannot handle, and I don't even think they make the MERV 13 or even certainly not MERV 15 filters for that school. And so I have to respectfully disagree that the Horace Mann building is sufficiently ready, especially when the district itself had already identified it as one of the buildings that needs to be closed and school communities need to be relocated as of this school year, actually, originally.
Well, respectfully, we have ordered the HEPA filters, and we have 500 ordered. And, those will be deployed in order to get our high needs kids back. So that is our priority, is to get our high need kids back. And so where we need to have those, we will have them available. The problem is the supply problem, is trying to get them out of the customs. And so we're trying all our best to get them out. I think we have 250. And there's, with the amount of students that we're going to have, which is such a small amount, we'll have well enough, hopefully, to be able to handle the capacity within our classrooms once we get all 500. So just for high needs kids, and then we have to, talk further about what we do further for the winter, what if we do come back with all in person. So
yes,
we've talked a lot about the high needs students, which they're obviously critically important and just sort of everyone's priority. We also have across the district a number of other sort of critical and important, significant transition years. When we think about our little ones, kindergarten, first grade, students who are just beginning their education, students who are transitioning into new school communities. So I'm thinking about anyone entering middle school, entering high school, or our seniors graduating from school. At all of those sort of transition points, having not just, the academics is obviously important, building the foundation, the love of learning, important. But that social and emotional piece is also really important for those transition years. How are we, especially now that we're all remote, and many of those categories of students won't be re-entering our buildings in a hybrid way for a little bit, right? Because we're focused on returning high needs students at this point. What are the things that are in place today, and what are we looking to add to have in place, because we know that they're going to be home for an more extended period of time to support those students during these critical years?
Well, I didn't answer those questions because I know you're having a big hearing on social emotional learning on Thursday, so I skipped over to more of the operational ones.
Well, even but thinking about access,
but I know
their school counselors, if they're preparing college applications,
all of that's
all those
happening.
other pieces.
Yep, and they have, a lot of our schools and teachers have taken time for morning meetings, meditation, reflection moments. They've adjusted their daily schedules to allow for that kind of time to happen. There's been additional one-on-ones and group time that teachers have done. There's a lot of creative work happening in this area, especially, and with our coordinated behavioral health team as well. There was a lot of work that they did over the summer that's spilling into this fall as well, and preparing for our students. So there's just that piece of it. I do think our teachers have really taken like what we had to learn from remote and bring into this piece, a lot greater supports for families and a lot greater supports for our students' social emotional learning.
Great. Sorry, whatever you hear in the background,
And I know they'll give you specifics on Thursday.
the background is the husband and the new puppy. Sorry about that. I don't know how much of that reprimanding of the dog.
Puppy, you lucky. I wish I could get a new puppy.
Come take him this evening.
So I'm sorry, Counselor Asabi George, I did just want to plug, you know, I don't do it enough. I know you saw him wave, but I will say that my son is learning to love his meditation time, and he's in the first grade over at the Henderson. And so that is something that they've incorporated, and he's loving it in the way that you would expect a 7-year-old boy to love it. He has his board on his lap and he's like coloring and doodling, but he's like, it's okay because I'm breathing and I'm listening to the nice words she's saying. Okay. That's Dr. McCann says that's okay. So I'm like, 2 thumbs up, Dr. McCann. Thank you. He's listening and breathing. We like it.
Well, I wonder too, and I see Mr. Francois, and I think Jonathan's got his hand up. I don't know if that's new or old. As well as Jessica, you know, another sort of piece of this is as we're looking and I think preparing to be all remote or mostly remote, we know we're working to get the high need students back into classrooms as much as possible. You know, are we thinking at all creatively about restructuring some of our days? When I think about the babies, the first graders, the kindergartners, and having a significant amount of time on screen, we know, you know, I have a conflict saying, I know we want teachers to be engaging with kids. We know it's important for teachers to have their eyes on their students, but it becomes a really long day, especially for the young ones. And where, you know, I'm hearing from parents of new students to the district, you know, babies that are struggling with enjoying school because it's changed so much. So there's, you know, we need to, I think, be able to include some creativity in this. We were all hopeful that schools would be more open, that there was this opportunity for in-person, but now that's shifted. Can we be a little bit more creative and shift some of the way that we're delivering instruction?
Yeah, and you know, we have our task forces that meet on this as well, and the principals are eager to continue to share and collaborate, like I shared earlier, to make sure that they're instructionally working with their teachers around helping them design PD and professional learning. So absolutely, we can do a lot more. It's never going to be like it is being in a classroom, and I think that's also just something that we're all grappling with, is that this is way longer than any of us thought or can even bear. It's just really, really tough on teachers here in Boston and across the entire nation. This is so different than what they were trained to do, and so different than what any of us, you know, parents included, you know, are having to deal with. So we're reinventing the wheel every single day, and teachers learn best from other teachers, and they are sharing their best practices to be able to restructure. This is especially true at the high school level, and I've given them flexibility, greater flexibility in their day to work out more flexible schedules. So they're getting those into the task forces now, and we're getting those approved.
Great. And then I know Jessica, Jonathan, and Mr. Francois. Jessica?
Well, I was going to let Mr. Francois go first because he had his hand up for a while. So
Thank
I think it was him and then Jonathan and then Mike.
Thank you. Mr. Francois?
Thank you, Jessica. Thank you, Madam Chair. probably my last time here on this. You've asked earlier, where do we go next and how do we go forward? I compare all of us as a body. So if the whole body is sick and you treat the whole part and then you leave the feet or a part of it, that place you leave can actually infect the other part of it. So, for instance, us as bus drivers, if we got sick or we tested positive or for some reason, we go back again in a bus that has no partitions, in a bus that may have kids without masks, and while we have the extra stuff to bring to them, in a bus that may not have any monitor because of a company wants to do union busting. I want to say that we don't have time for union busting. We don't have time for unrest too, for turmoil in the city. And it's a matter of life and death. It's like we need to take a look at the bus drivers more seriously. And having a company having $350 million to run 1 year of a contract, and they're not doing anything. They come in and just be micromanagement, doing micromanagement by BPS or by somebody to try to bust a union and get all the money without doing anything. So it's outrageous. So we'd like to have this culture change, definitely, because we're not looking to have like problems right now. We need to save our family, to continue to survive. It's survival. So they need to do a better job at that. Somebody got to take a look at them and let them work with us, and instead of doing what they're doing. I forgot the first thing I had to say, which was important. But if I get a chance later, I'll bring it in. Thank you.
Thank you very much, Mr. Francois. Jonathan, and then President Tang, and then we do have some members of the public signed up for public testimony, so I'd like to get to them.
Yeah.
Thank you. We're just looking for recommendations here. So one recommendation that I have is in the memorandum of agreement, we agreed to set up safety committees at the school level. The safety committees would include 2 BTU representatives, a nurse, custodian, administrator, some other folks. And I think that it should be a priority of the district and the BTU to work together to ensure that we do have, in fact, safety committees with that grouping together in every school, because the goal isn't just to open school for a handful of kids. The goal really is to open all the schools eventually. And that may not be a short-term, that may be not a short-term goal or a medium-term goal, but we need to keep our eyes on the prize, which is that we want all our kids back in school. In-person learning is better for everybody. And so I think one thing that we can do to start a bottom-up rather than a top-down approach to planning and assessing is to work together to have these safety committees really work in every single school, have them convened, and encourage a cooperative approach between the BTU administration in every school and everybody. That's part of the MOA. So it is something that we've already agreed to, and it's something that, but it needs to be implemented like everything else. Secondly, I think we need to, a lot of people had comments about my comment about air quality. I think that the testing that everybody was referring to is the CO2 testing. That's not the testing that I was referring to. I'm referring to testing that actually tests the air exchange rate. And so I think that we need to look into and work with MassCOSH, is Massachusetts Coalition for Occupational Safe and Healthy Health, the Harvard Chan School of Public Health, to make the recommendations about air exchange, the need for to assess air exchange, and to work together to start to assess our rooms, the buildings, for air exchange rather than for CO2, because that's a proxy kind of a test, the CO2 test that we've been talking about. So I think that's another suggestion I would have of a step that we can take together. And finally, I think that I want to look at universal testing of staff and students. And there's an article recently I read, I don't remember where, but hundreds of colleges and universities in New England are using a universal testing model and having great success with it. And it's being done out of Cambridge with the Broad Institute. And they have the experience of institutionalizing this kind of testing where everybody gets tested on a regular basis. It doesn't, we could come in collaboration, I think we could come up with a plan that makes sense for BPS and that can be rolled out in the same way that as we're expanding the number of students and staff and buildings, we just make it bigger and bigger. And it's right across the river at the Broad Institute. And they've done it with 100 colleges and universities with a pretty good success in New England. And so I think that that's another step that we should take, a concrete kind of next step that we should take together and look into that. Thank you.
Thank you, Jonathan. And Jessica, and then Dr. Caselius, then we'll get to public testimony.
All right, thank you. I'll try to be brief. I just wanted to share that we did suggest that to the district, the Broad Institute, because when the B2 nurses had suggested that, we brought that idea. And Madam Chair's question was, how do we move forward and collaborate? And we've always wanted to do that. And I guess that's been the frustration, is that we've shared these ideas, which have been largely ignored. And then, even with the air purifiers, as Superintendent had shared, we had asked for those 500 air purifiers specifically when we were still in hybrid, and trying to get them for the medical waiting rooms and the nurses' offices to start. And that's what originally the intent of those 500 air purifiers were. And we had also asked for them for the special needs classrooms and our early education classrooms, so that our young learners could come back in person sooner rather than later too. And I do think that is a way forward, is getting those HEPA air purifiers in not just the medical waiting rooms and the nurses' offices, but also our special needs classrooms. And so I'm very glad to hear that that some of those air purifiers will be now at the Horace Mann, but I didn't know that. And I think if we're going to truly collaborate and move forward and working together, we need information. And I can't, there were so many things I learned tonight, and I shouldn't have to learn information through a city council hearing. There've got to be better systems of communicating if we're going to truly collaborate together. And that also means, hearing our proposals and really taking them to heart, and not picking and choosing what parts of the MOA are honored, but honoring all of the agreements that we make, because it takes a lot of work to get to those agreements. So I hope that moving forward, our MOA is fully honored, not just parts of it, but all of it, and that we can continue to get information in a timely way, because the sooner we're able to get information, the sooner we're able to help disseminate it to our members and educators, and the sooner we're able to problem solve and identify potential issues, even with the most well-intentioned plans. And so I truly hope that with the start of this new HIPP task force and the reopening task force from the second MOA, we can continue that collaboration in a truly meaningful and transparent way. Again, we can't help with solutions if we don't have the information, and we need the information in a timely way.
Thank you, President Tang. Superintendent Caselius, and then we'll get on to public testimony.
Well, I don't have much to add other than really just to thank you for this hearing. Obviously, there's a lot to be addressed in this conversation. And if I could wave my magic wand, I would have a HEPA air filter in every single classroom, in every single building. I would have HVAC. I would have hot water that's running freely, and I would have N95s for everybody, even if you didn't need it. I think that if we could have everything, we would do that. But everything also does have to be weighed with the science and what is absolutely required. And we are trying to follow the guidance because we don't have an unending pot of money to buy things that are not, sound for what guidance says we should do. So we are trying to find the guidance and try to do what we can do. And I would love to be able to test everybody every day. I wish we had the technology and the saliva things to be able to do something like that. So I just want, you and the public and Ms. Tang, especially and her members, to know that we will continue to work with them as we continue to work around these evolving nature of this virus, the evolving science, and try to do our best and put forward plans that we think are the ones that are going to keep everybody safe and provide the best education possible to our children, and prioritize those students that need it the most first as we begin our reopening plan.
Thank you, Superintendent. So with that, I appreciate everyone being with us today. We are going to move to public testimony. If you need to come off camera for a few minutes, because we've been at this for 3 hours, that is okay with me. But I do want to just pull up my notes here. So I have those that are joining us for public testimony. I think Shane will be letting them in. So I'm just getting to my notes with the list of those that have signed up for testimony. There it is. So if you are in the waiting room, we have Sharon Hinton, Nancy Lesson, and Elise Pitcher. If you could raise your hands, we'll let you in to offer testimony. And we've got a few others after them. Thank you, Shane, for letting folks in. Sharon, are you with us? Am I not seeing you on my screen? I see Nancy. If we'll start with you. I don't see Sharon. If Sharon wants to sit up, raise your hand. Nancy?
I'm Nancy Lesson, a retired occupational health specialist, member of Massachusetts Health Technical Committee, mother of a BPS high school teacher, grandmother of 4 BPS elementary school students. I testified last week about serious concerns regarding airborne aerosol transmission, the tiny microdroplets of virus that float in the air for longer time and travel longer distances. We know that poorly ventilated indoor spaces are risk factors for airborne transmission of this deadly virus. And there are long-standing problems with ventilation in BPS. The tests BPS did this summer measuring CO2 levels in empty rooms are meaningless. Given the decision Wednesday to go full remote, this is the time to pursue proper testing to identify spaces with the needed ventilation rates. Ideal is 6 air changes an hour, excellent is 5 to 6, good is 4 to 5, according to the Harvard Chan School of Public Health Measuring Ventilation Rates in Schools document. This testing, conducted with a bolometer or similar device and can be done in unoccupied rooms, is a simple, accurate way of testing ventilation rates in schools and rooms with mechanical ventilation, the 37 schools with HVAC systems and 46 schools with unit ventilators. Identifying safer spaces also includes assuring filtration to eliminate viral particles that may be present in recirculated air. It is important to have MERV 13 filters in HVAC systems that recirculate air, as well as portable air cleaners with HEPA filters in all other spaces. As for the 47 schools and all rooms without mechanical ventilation, those with one open window and a fan that don't provide ventilation rate or filtration needed to address airborne transmission, the ones that will curtail learning and cause health problems due to cold temperatures, a serious discussion of how to make these rooms safer is critically and immediately needed. One last quick thing. The air testing documents on BPS's website states, quote, "It is important that the space tested for CO2 is occupied during the test to ensure the results accurately show the effectiveness or not of ventilation systems," close quote. The documents on BPS's website also state that all tests were taken in unoccupied rooms. as the superintendent is claiming, this is a passing grade on ventilation. This is both horrifying and terrifying. Thank you.
Thank you very much, Nancy. I don't see that Sharon Hinton has joined us, so we'll go to
Sorry, Madam Chair, you're muted. No one heard what you just said.
Thank you. Elsie Pitcher, I don't see you on, so we'll go to Jody Sugarman Brosen. Jody?
Thanks so much. My name is Jody Sugarman Brosen. I'm the Executive Director at MassCOSH, the Massachusetts Coalition for Occupational Safety and Health, but I'm also the parent of a BPS parent of 14 years. Many folks have referenced us tonight. MassCOSH is a nonprofit organization that works to ensure that all workers can go to work, earn a fair wage, be treated with respect and dignity, and return home to their families alive and well. I really thank you for the opportunity to be here tonight, and I want to thank all of those who've been here answering questions for several hours. COVID-19 has created one of the worst worker health and safety crises in history. Since the beginning of the pandemic, workers on the front lines have been getting sick and dying from workplace exposure. On September 10th, MassCOSH released a report, Dying for Work, documenting the pandemic's deadly toll on Massachusetts workers, which lists 59 Bay State workers known to have died of COVID-19 after potentially being exposed at work. It did include the workers, the Boston Bus Drivers Union, and I just want to say again my condolences to the Boston Bus Drivers Union. The sad piece is that this report likely grossly undercount the number of workers who had been made ill or died because the state of Massachusetts has failed to collect data. We do, however, know that 87,000 Massachusetts working age residents have tested positive for COVID-19 from March 10th to July 31st, the last time we had a count, and that 1,349 working age residents have died. Why am I talking about this? I think it's really important to think about this as we talk about reopening schools and bringing students back. We have already failed to protect workers in this state with deadly consequences. And adding to this situation is the state's own COVID-19 workplace safety regulations exempt K through 12 schools. So if you work in a K through 12 school and your school is not following the guidelines, who do teachers have to turn to? What support do they have to ensure that they will get compliance with health and safety regulations? It's really a critical question. And while social distancing, hygiene protocols, and cleaning are all important, as been said here many, many times, one of the key ways that school staff and students are exposed to this deadly virus is via aerosol transmission of microdroplets. CDC updated its guidance on COVID-19 and how it's transmitted to affirm that it can be spread by airborne transmission. And I have to say that the guidance on school reopening that the CDC has put out does not say one window is enough. There are 644 words about ventilation and considerations around ventilation, and says that it should ensure systems operate properly and provide acceptable indoor air quality. So it's just important. Yes, CDC guidelines are changing. They have been updated. One window is not what CDC is recommending. It's really important that we address issues of ventilation. And now with COVID-19 rates continuing to rise and schools going all remote, we have an opportunity to take needed actions to ensure that schools are safe when rates allow for them to return back to our school buildings. As we said before, Boston Public Schools has not yet proven that buildings which already had ventilation and indoor air quality issues before the pandemic are sufficiently ventilated. BPS documented indoor air quality tests in every school and declared that each building passed. This was determined by measuring the concentration of CO2 in unoccupied rooms, which BPS's cover page accompanying the results acknowledge is a meaningless metric. CO2 measurements are only useful as a proxy for ventilation if the room has been occupied, if there is actually a source of CO2 to measure. And I have to add, as a parent, that it's been very misleading in how these CO2 measurements have been shared. In this week's weekly update that we received just yesterday morning, there was a link to the results of Boston Public Schools indoor air quality tests with no information on how these measurements, how little these measurements actually tell us about the safety of indoor air when buildings are occupied. It's really easy. Just look back several years to look at those CO2 measurements to see that in fact our buildings are not meeting CO2 guidelines. To know if a space is safe, we need to know the rate of ventilation in each classroom measured in air changes per hour. According to Harvard School of Public Health, 3 to 4 is the bare minimum, 4 to 5 is good, 5 to 6 excellent, and 6 ideal. Luckily, with the use of a bolometer, it's not hard to measure air changes per hour. They can be taken, these ventilation measurements can be taken in occupied or unoccupied rooms. We also need a plan for what will happen this winter when temperatures drop well below the state standard for reasonable indoor temps for schools. Will teachers be forced to keep windows open and fans blowing to provide adequate ventilation? And how will that impact students or teachers with asthma that may be triggered by excess cold? The solution is simple. Using science, conduct ventilation assessments, find the safest learning spaces, use those exclusively. It may mean that all students cannot be in their own schools, but that to me seems like a small price to pay for their safety. High priority learners need services, but not at the cost of their own health or that of teachers. These are life and death conversations. We've watched it roll out in other workplaces across the Bay State and across the country. BPS must commit to all necessary mitigation efforts needed to ensure that when in-person learning occurs, it happens only in safe instructional places. Thank you for your time this evening.
Thank you very much, Jody. Next, we have Elsie Pitcher and then Trevor Smith. Elsie or Elise? Elise? Elise, are you with us?
Can you hear me now?
We can hear you now. Welcome.
Thank you. And thank you for giving me this opportunity to participate. And at the risk of perhaps repeating some of the things that have been said before, I would like to emphasize a few of these points. My name's Elise Pector. I'm a Boston resident, a grandmother of 2 children in the Boston schools, and a certified industrial hygienist with 35 years of experience in assessing workplace health and safety, including schools, and a volunteer with Massachusetts Health Tech Committee. The independent air quality tests that Commissioner Caselius reported previously that had been conducted were meaningless. Measuring carbon dioxide as an indicator of ventilation when buildings are unoccupied shows nothing. Carbon dioxide is exhaled by people. If no people are present, there's nothing to measure. There's no source. Even more distressing is the illusion or false reassurance that something useful had been done. Nor is it correct to say that CDC endorses windows as adequate ventilation. The CDC has been slow to adjust to the science of aerosol transmission of COVID-19. And most of what CDC actually says is they want to enhance mechanical ventilation by opening windows when weather conditions allow. Well, so I think we have to look backwards for a minute. You know, in 2017, when the Boston school buildings were assessed, they wrote even then, classrooms lack proper ventilation. Most of the systems have been blocked. Operable windows, which are weather dependent, don't work well. To quote, these systems are often inoperable, inefficient, and incapable of filtering air, and many have lost their connection to outside fresh air. And in their summaries, they said 69% of elementary schools have deficient or poor ventilation. All right, so we know that the district knew then that the ventilation was inadequate for education. And the importance of ventilation for education was emphasized by our local expert, Professor Joe Allen at Harvard School of Public Health. He especially was just commenting on the links between cognitive function and ventilation. All right, so if the ventilation was inadequate then, We know it's inadequate now during a pandemic viral illness passed through the air. All right, so now we have to look forward so that a few years from now, we don't add COVID illness, disability, and death to the toll from inadequate ventilation. Relying on one open window per classroom to reduce virus transmission is inadequate. Adding fans may help, but not sufficient. Windows may help when they can remain open, but they'll be closed due to the weather. In addition, the fans don't fit in the variety of buildings and classrooms and windows in the Boston schools. You can't even measure ventilation that is provided solely by open windows. And I even observed a fan fall out of a window during a school walkthrough before the initial school opening. And even the schools with ventilation, some had CO2, carbon dioxide levels greater than 1,000 parts per million, another indicator of inadequate fresh air supply. So I hope we can use this time wisely. Over 1,000 cases of COVID-19 were diagnosed in Massachusetts again today. We need to find the buildings and the classrooms that have adequate ventilation to support in-building instruction. We have to add portable air cleaners where this will enhance protection for staff and students. We need to provide staffing that addresses in-building and remote education and additional support for remote education. So now, have ventilation and industrial hygienists or air quality experts been consulted about how to make the best use of the buildings we have? We really need to look at the science that's being used to make these decisions and to begin a serious process to create safe environments going forward. There's so much more we could discuss and review, but I really hope that we can share the scientific bases of all the decisions being made and improve the trust and the guidelines in the process that are being used in contemplation of reopening. We have to look forward. We have to use the precautionary principle. We have to prepare to make the best use of the safest spaces within the Boston schools and improve the ventilation and filtration in additional locations as we can. Thank you again so much for the opportunity to participate in this process.
Thank you very much, Elise. Next, we have Mr. Trevor Smith. Trevor?
Hi, thank you. I'm gonna be very brief because I think just for sake of time and things, but I just wanted to say thank you so much. I'm a teacher at Boston Latin School first and foremost. I also live in Dorchester, and you know, it has been really hard for us teachers. You know, we've been putting in hours after hours, you know, trying to help our students, but also, you know, I've been tested 3 times. Luckily, I've been, you know, negative, but I still live in the you know, neighborhood of Dorchester where our rates just keep rising, which is, you know, I'm taking all the necessary precautions, and I still fear, you know, going into the school buildings. So I hope, you know, everything that we've talked about today can be addressed. I hope that we can, you know, put and use all of our plans and you put all of our brains together in order to, you know, bring our children back into school. I'm just going to seek, I'm just going to continue to look to our president, you know, Jessica Tang, and I think, you know, she hit the nail on the head. It's all about communication. You know, I'm on this call with, just as you, I'm hearing all of these first things as an educator, which is very concerning. So I think we have to look at and address, you know, how we get the communication out to our educators and to our parents so that we can all collectively work together to stop the spread of this disease. So thank you so much, Councilor George, and I appreciate it.
Thank you, Trevor, and thank you for being an educator. Last on my list for public testimony is Danielle Tierney. Danielle? Danielle, you with us? Danielle? I'm gonna give her another minute or so. but it looks as if we maybe have lost Danielle. So I will use this just next few minutes just to say thank you to everybody for joining us. I think this is a really thorough and thoughtful, certainly passionate conversation today, hearing today about reopening of our schools, the process this fall so far, and the changes that we've seen. I think that we have an opportunity to tap into some of the conflict that was on display here today in a very positive way. I think sometimes from conflict, we share a little bit more through conflict. And I think it presents us an opportunity to do a few things a little bit better and a few things differently, and to double down on a few other things. I think there's a lot of great things happening in the district, but there is a lot of fear, there is a lot of anxiety, and there's a lot of concern. Some of it is very real and very legitimate, and others aren't, but they are legitimate until people are educated and know differently. So I think that it's really important that we continue to share, we continue to talk, we can continue to communicate with one another and with each of our constituencies on the reopening of schools, so that we can get to reopen our schools and to do it safely for both our kids and for our educators and for our communities at large, because it is important for schools play an important role in our communities, and we want them open, and we want our kids to have the ability to be in class in person. I know that's how I feel about my own children, but it's how very, I think all of us feel. We want to be in school and we want our kids in school. We just need to get to a place where we can alleviate those fears and anxieties and take some corrective measures and share the appropriate information. I rambled on just a little bit there. I apologize for that, but I'm grateful that everyone was here today. I'm grateful for the work that you continue to do on behalf of all of our students and the various roles that you all play to work with our kids and our families. So with that, I'm going to adjourn this evening's meeting and just say thank you. I don't have a gavel or anything like that, so just going to say good night. Good night, everybody.
Good night. Thank you.
Night. Thanks, Andre, for being here.